All right, we are recording. So good evening, everybody. Welcome to CB4's Housing, Health, and Human Services May 2021 meeting. I am Marie Ortiz. I'm the co-chair along with Joe Restuccia. And let me just give you the run of show really quickly. This meeting is being live streamed on YouTube. Also, it will be living there. The recording will be living there on YouTube as well. The materials for tonight's meeting are public, as well as the agenda. If you sign up for our listserv, you can receive that every month for all the committees, actually. If this is your first meeting, welcome. Thank you for being here. What's going to happen is there are going to be 3 presentations today. After each presentation, first the committee is going to speak and ask questions, make comments. Then the members of the public, known as the attendees, can ask questions and speak. On some of the agenda items, what happens after the public speaks is the discussion goes back to committee. And sometimes we make a decision to write a letter of support or write a letter where we make recommendations. And the most important thing for everyone to know is if you want to speak or ask questions after each presentation and after the committee speaks, to press the raised hand button. That's how we'll call on you. If you are calling in, I didn't check if anyone's calling in, but if you're calling in, you're gonna press *9 to raise your hand and *6 to unmute. Again, that's *9 to raise your hand and *6 to unmute. Tonight on the agenda, we have 3 items: DHS presenting Gateway Housing, and then, oh geez, I forgot the 3rd item, 312 West 43rd Street.
Correct.
And let's get to the first item. Let's just jump in.
So just one moment again. There are 2 people who have called in. So again, *9 to raise your hand, and then *6 when you want to speak. And what will happen is the assistant district manager will bring you over into the meeting, so then you can turn on your camera, we can hear you. We need to do introductions first, quickly.
Can I just make a real quick, just a point of information, Joe?
Yeah.
Just for clarity's sake, because Maria mentioned this at the beginning, not all of the material that's being presented tonight is in the public Dropbox. The agenda is in the public Dropbox, but the applications themselves are not in the public Dropbox. So I just wanted to clarity's sake, if people are from the public are looking in for that, not seeing that, they're being presented tonight publicly for the first time, and we can provide that information to anybody that needs it after the fact.
Oh yeah, thank you, Jesse.
No problem.
So, introductions. Maria Ortiz, co-chair, Housing, Health, and Human Services. Myself, Joe Restuccia, co-chair, Housing, Health, and Human Services. Leslie.
Hi, Leslie Williams, member.
Betty. Let's go to, while Betty's getting ready, let's go to Paul.
Hi, Paul Ames, public member.
JD.
Good evening, all. Jean-Danielle Nolan, member of the committee.
Josephine.
I was muted before.
Yes, you are.
Oh.
Go ahead.
Oh, Betty McIntosh, member of the Housing Committee.
Josephine.
Josephine Ishman, member of the Housing Committee.
Jessica Chait's on the phone. She'll be back in a second. Lowell.
I'm Lowell Kern. I'm the chair of Manhattan Community Board 4.
Martin.
Martin Trees, public member.
Great. So, and then we have with us Leilani. Introduction.
Oh, we can't hear you.
Yeah, I'm mute.
Hi, good afternoon. Can everybody hear me?
Uh-huh.
Yes.
Hi, I'm Leilani. I'm the Manhattan Borough Director for the Department of Social Services. I'm essentially the liaison between the agency, community board, elected officials, stakeholders, you name it.
Yes.
I look forward to
So
presenting.
welcome, Leilani. And before we start and get a report from DHS, I just want to note for the record that Leilani tonight is the sole representative of DHS. We really appreciate your being here, because there should be many more members of DHS here, and there should be deputy commissioners, assistant commissioners here to present and discuss a broad range of issues that our neighborhood has been dealing with. You are a frontline person. We want to acknowledge you have done your best. However, there should be people who are at a much higher level of decision-making be able to respond, because I just want to say to the public and the committee members, Leilani will take questions. We should grill her, whatever we want to do. But there are people who should be here who are not. And I wanted to make that clear. Sorry, Leilani, I want to just put that out there so everyone understands that people may shoot bullets at you, but it's not you. There's a lot of other people involved in this process. So thank you so much for coming tonight and being here.
Thank you, Joe, for framing that. And I was actually going to say, thank you, Leilani. I see you all the time at the district. I've been to the district service CAB meetings. I've seen you there. I see you monthly at the DHS meetings with all the providers. But we specifically did request for senior leadership, such as like a deputy commissioner or the commissioner, and to be present for this meeting. So that's me express. I know I don't look frustrated or disappointed right now, but that's me expressing it. And the reason why you were invited first was because we wanted to talk about the fact that what is the plan DHS has to return residents back to congregate shelters. The community as a whole is really asking that question. And also, number two, what is the vaccination plan for residents and staff occurring on site? And I just want to give some context to some people who are on the call and may not know like all the details and intricacies. Due to the pandemic, we all know that folks who are in congregate shelter settings, so let's say 10 or 20 people in a room, sleeping in a room, had to relocate into hotels for safety reasons, obviously. And they moved into hotels in our community. We received 8 emergency temporary shelter hotels in CB4. And at the height of that, it was over 2,000 beds, shelter beds in this district. And that's excluding
2,200.
Mm-hmm.
Yeah.
2,200, and that's already excluding the shelter beds in the district and the beds where folks are who receive social services, so supportive housing. So in all, that brought us to almost 5,000 people with high social service needs in the community, and many of them not receiving the services that they need. And in fact, on one block radius, we had over 800 people. And we appreciate that DHS has relocated 2 of the sites due to density issues on the block. DHS has been, for the most part, communicative, although not with everything we ask. And right now we have 5 sites, 5 reduction, they're called, DHS calls them reduction in density sites.
Density reduction sites.
Mm-hmm. And about a few, I forgot how many, a few family shelter sites. Ultimately, we want to hold DHS and the mayor's office accountable to create a better plan when returning to congregate shelter for the sake of the residents, the staff, and our community members. And that includes, and I've mentioned this before in the meetings, is the monthly meetings that we have. That's including the congregate sites in CB4 that we already have, and that's 3 of them. Every other industry has a plan, and if DHS has no set date to begin returning folks back to their congregate settings, what is the contingency plan until then to better support and begin in-person services and programming for the residents in the hotels? Because we can't continue as we are. And the second thing is that, what is the DHS plan around vaccinations? I know that DHS had 1 hub per borough, and then you also began on-site vaccinations. Then you had to discontinue it because it was Johnson & Johnson that was being distributed. But I have to say, it seems disingenuous or insincere for the mayor of DHS to say that they care about the most vulnerable New Yorkers and not make vaccinations as accessible as possible. And I don't know, Joe, if you want to add anything else before.
I just want to frame it for the public to know where we want to go tonight. So we are coming up to almost a year anniversary of this relocation for temporary shelters. We all understood it, absorbed it, and it has been plagued by incredible mismanagement by some of the providers, not all, and by DHS. We started out with horrible communication that got better, but the truth is, as Maria has said, we've been told all along that there had to be a vaccination plan and metrics to determine how people could go back and actually be in congregate shelters again. We have been totally engaged with the shelter providers, understanding that no one is getting the kind of services they need in these temporary hotels as compared to what they would be in the congregate shelters, which are many of which are purpose built for that use. So our community, because of the vast density of people who have high social service needs, mental illness, substance abuse, addiction, not getting it has created a huge issue in the neighborhood. And there has been an incredible spike of very troubled people, not well served, creating other issues. And unfortunately, what we're dealing with, and the public is well aware of this, is that some of the crimes that have been committed, like hate crime on 43rd Street, the most recent crime on 42nd and 11th, was directly came from shelter residents. We as a community and a community board have been trying to make clear that not everyone is a bad apple. The problem is some of the operators are not the best operators and people are not getting served. And therefore we have huge consequences. And the issue we have in our district is a serious public safety one, because the other unintended consequence is a great number of people. Oh, Yvonne has joined us. That's fantastic. Thank you, Yvonne.
Thank you. I've actually been here for the entire meeting, but I wasn't heard. So
haven't seen your
hi,
face.
everyone.
Thank you.
Thank you for being here, Yvonne.
Very much. So the unintended consequence is a lot of substance abuse issues and addiction issues have drawn a great number of people who are selling drugs in our district. It's almost created a market for drugs. We have ongoing issues in the street with people shooting up on the street, and a big confusion between street homeless and the residents of shelters. But in the end, the public has experienced a huge decrease in public safety. We don't want to work together to get this to get better. And we really want to hear first, let's hear first about the vaccination plan, what can happen, because all of us working with vaccinations are trying to make vaccinations as easy as possible for people to deal with and as simple as possible. So if Leilani or Yvonne, you can take that first, and then we'll go talk about the relocation stuff.
Sure. Well, first of all, thank you all for having me. As you know, I've been communicating with this board, I would say what feels like quite often on an array of different things. We do meet on a monthly basis with CB4 and other elected official principals, with all of the shelter operators in your community district. I know that that was a request and ask of the community board. And there is where we try to capture in real time any incidents or concerns that may be brewing in the community. And so thank you for having me, and thank you for always being an amazing partner. I'm going to dive into your question regarding the vaccines. You know, we at this moment in time, there is what we call distribution hubs, one distribution hub per borough. In every borough, we have a vaccination distribution hub where we make referrals for DHS shelter clients and staff, including our street homeless population, if should they wish or choose to receive the vaccine, where we make the referrals for individuals who are interested and open to taking the vaccine. You know, the health and safety of New Yorkers experiencing homelessness, who we serve, is of course our #1 top priority. And as soon as the state expanded vaccine eligibility to include our clients, we created a dedicated hub that I just expressed, which is located on 25th Street and 6th Avenue. Is that correct, Yvonne? It's the Jack
Between 7th and 8th.
Between 7th and 8th Avenue is where the distribution hub is. And that is all of our clients, families with children, single adults, adult families, and our street homeless population has access to that, in addition to what is whatever public facilities and local CBOs may be offering the vaccine. That also is something that our clients can take advantage of as well, of whatever else is in the community. But recently, following the federal approval of the Johnson & Johnson vaccine, which allowed for us to increase flexibility in the administration and delivery of the shot, we proactively expanded our efforts to include mobile vaccine distributions at select DSS and DHS shelters that served our clients who are more at risk. So that included our single adults who reside or was residing in congregate shelter settings. and unsheltered individuals residing on the streets and other specialized facilities. And so building on that existing infrastructure of our agency, COVID-19 testing apparatus, through this effort, we've made important progress vaccinating vulnerable New Yorkers experiencing homelessness. And so after briefly pausing the administration of the Johnson & Johnson vaccine, because as many of you may know, there was a pause and there were some concerns centered around the Johnson & Johnson shot. Our federal partners did their due diligence and asked us to pause as they monitored the safety around that particular vaccine. But we were at one point delivering the Johnson & Johnson shot to sites. So we were providing the vaccine on site at particular locations, but we paused on that. But what is still made available is for individuals to be referred to our distribution hub. And just in general, throughout the DSS and DHS system, both at our dedicated hubs, through the mobile vaccine effort, we've administered more than 18,000 vaccine doses to DSS, DHS clients and staff so far. And with nearly 12,000 individual New Yorkers now, we've calculated have been fully vaccinated with effective vaccines. And so, you know, as the vaccine supply becomes more readily available, we're continuing to adapt our approach and how we're administering the vaccine and doing everything we can to ensure that it's easy to access for some of our city's most vulnerable residents and essential frontline workers, including the staff that are operating the shelter sites in your community district in these hotels. And just want to quickly just mention that you know, a lot of our frontline workers were impacted during the pandemic. And so we're really thrilled and happy that they too will have the opportunity, just as our clients are, to make sure that they get vaccinated. You know, you did express, Maria, at the top of this meeting, the agency's rapid reaction to the pandemic. But I just want to kind of I kind of want to touch on that point because it was us operating in the midst of an emergency. We have never been in this space before. This is an unprecedented moment and an unprecedented time for the agency. We do understand and admit that there may have been some moments that things that we could have done better, not denying that. But here we are, and we wanted to make sure that it was our business, and we make this commitment still to make sure that we are trying our very best to make sure that we're responsive, that we're monitoring to the best of our ability and maintaining shelters and our clients as they integrate themselves temporarily in new communities. This is a new community that we're in as they come from previous other locations. So, you know, we did spend a lot of time during the pandemic all last year and now even trying to integrate ourselves in the community and familiarize ourselves with the area. And we're hoping now with the things reopening that, you know, our residents can take advantage of other public spaces and other public use and events. And we look forward to your partnership with the community board in helping us identify helpful and healthy linkages in the community. And so with CB4's support, we were able to connect some of our providers to healthcare providers like Health Ryan Center, who also was offering vaccines, administering the vaccines. I do know that some of our density reduction hotel operators did take advantage of that helpful partnership. That was a linkage created by way of Community Board 4, so we thank you for that. But that's where we are at this moment in time with the vaccines. And I hope that I was clear and that was helpful information for you all.
So let me try to focus back on that for a second. So our request is for DHS not to just have a hub, but in these various density reduction hotels, have a partnership in order to do vaccination in the site. My organization, Clinton Housing, operates 5 supportive housing sites, about 400 units of supportive housing. We found the way to reach people was to bring the vaccination to them. and then to have the caseworkers reach out to them, people they know, they trust, and talk it through, and have neighbors reach out to them. There's a lot of vaccine hesitancy. Everyone's aware of that, right? So we are making a request to you to work with us and/or Ryan Health Center, as opposed to a hub, to schedule, engage, and have vaccination sessions at each hotel, because the sooner people are protected, it also helps you plan properly for bringing people back to congregate settings. I'm not making that up, right? I mean, that's part of the thing, getting people as safe as possible in order to go to a congregate setting. And I think Yvonne wants to say something.
So let me just jump in and tell you as well, we do offer the vaccines at the sites. Every 4 weeks, we have a medical unit that comes in, and they're scheduled every 4 weeks to go into every shelter that we have. We offer vaccinations along with testing, as there's a lot of hesitancy around the vaccines. And so to kind of like get past that, you know, we prompt our providers to come up with unique ways that we can encourage our clients, encourage the staff to take these vaccinations. We are offering a lot of incentives now for our staff and the clients, more importantly, the clients, to take their vaccinations. But every 4 weeks, we have a team of medical staff that goes in. We vaccinate, we provide this, I want to say 11 to 12 shelters per day.
So what if we continue to work with you and assisted you, not just every 4 weeks, but work with Ryan Health, who has been very, very active and very helpful on bringing vaccinations out to various larger buildings, affordable housing buildings. They've done everything all over the neighborhood to have more frequency than just every 4 weeks.
We could take this back to our office of the medical director, and maybe they could reach out to Ryan Health, and then we can work from there.
Okay, because I think getting more frequent
I'm sorry,
visits.
could you,
Go ahead, JD. Yes.
so Maria, could Ms. Ballard identify herself, please?
Oh, I'm sorry. Yeah, I apologize.
I'm
That was
sorry,
my-
I meant to mention that also. Thank you.
Hi, I'm
Julie.
Yvonne Ballard. I'm the Associate Commissioner over Shelter Operations for the Adult Division.
It's citywide. Yes.
Yes.
So any questions from the committee? We'll stay on the vaccination issue first and then go to the relocation. Anyone from the committee about getting the shelter residents vaccinated? JD?
Joe?
Yes.
Yeah, just, I know you probably can't answer this, but is there any timetable that you have in mind as when they can be vaccinated and move back to their original homes? Is there any idea?
We're going to get to that in a second. I just want to stay with the vaccination issues. Anything else that we can offer, or maybe we can ask you, Leilani or Yvonne, do we have any sense of what percentage of individuals are vaccinated in the current density reduction shelters, so we have some sense of what's going on?
We can say throughout this system that we've administered more than 18,000 vaccines. We don't aggregate that data by site. That data is aggregated and assessed system-wide.
Right, I know, but you're in a local setting, so we're concerned about the locality and what the efficiency is of people getting vaccinated here and becoming safe. There's an issue on the streets of people congregating, people acting, there's a mental illness happening, that there's a safety question that comes out a lot in the public when we have meetings. So we could also ask you, I guess, Yvonne and you, if we can understand, and not like down to fine grain, but just in our district, what is that percentage to understand what it is? You have to tell us now. If you can get back to us, we'd appreciate that.
Sure, and we do share that information on our monthly meetings, but I'll have to circle back with those specific numbers for you.
Yes,
Quick
Jessica
question.
Chait.
I'm sorry, let me just jump in for Leilani or Yvonne. 18,000 residents within the entire system. Out of how many do you have right now, approximately? Is it still 60 or 65?
It's a little under
1,000.
our census for the first time. It's a little under 60. I have to get back on the exact number, but it's a little under 60. Our census.
60,000. Okay.
60,000, folks.
Yeah, 60,000.
So then Betty and then Jessica.
Yeah, hi, thank you for your information. I have a question about people who are living on the street or the sidewalks. Are they getting vaccinated, or is somebody trying to help get them vaccinated?
So it's an excellent question. As it relates to our street homeless population, how it works is when our outreach teams go out, we have outreach workers that canvass New York City on a daily basis, and particularly speaking to this borough in Manhattan, we have contracted street homeless outreach providers who on a daily basis, they do daily tours and canvass what we call hotspot areas. They heavily rely on 311 system to track and indicate which locations in the borough or in the community, in this community, they should be canvassing and how often they should be canvassing it. And when they do engage street homeless individuals bedding down, they have what is, you can call a survey that they do, and they run through a gamut list of questions with these individuals to assess their health and their well-being. If there are any flags indicating that they're presenting COVID-19 symptoms, they then will, it's always at the discretion of the individual. Of course, we can't enforce, so we can't mandate, we can't make anybody do anything. But if they're willing to come with the outreach teams, we'll connect them to care. And then there is where they can get tested for COVID. We also can do that on the street if they allow the teams to do that. And if they're open to receive the vaccine, the teams will make the appropriate referrals to ensure that that individual gets vaccinated. But it's always at the discretion of the individual, as we're not an enforcement agency, but we're here to provide services and shelter for those in need on the street.
Let's go to Jessica.
Can I just have a follow-up
Yeah, sure,
on that?
sure.
If
Go ahead, Betty.
there are some encampments, I live in Chelsea, mattresses, everything. And who would it be best to go to 311? Because if that's the trigger for the vaccination rotation that they pick up on those encampments?
No, what I would say is always reach out to 311. If you see someone on the street, they look like they're in need, they look like they may be street homeless, I would say that is the appropriate moment to contact 311. It's the outreach teams who would do the clinical assessment. It's the outreach teams that would then address the situation and connect them to care depending on what the situation is. If it's an encampment, they'll know how to appropriately flag that to our sister partners, DSNY and others, to do a cleaning. But in short, I would say always contact 311, period, okay. See a street homeless person in need.
Okay.
Jessica?
Thank you.
You're welcome.
Well, my question was actually Maria's question, but in light of the answer, just 30% vaccination rate is quite low. And I would hope that DHS is considering new strategies, whether that's like ambassador programs. I don't know, stipends, I'm not sure, but 30% is just very frightening. So I hope there's a concerted effort to increase that across the system.
And is that 30% include staff or just residents?
I don't know. I'd have to get to the specifics. I would imagine the number I just shared is primarily are for our clients. But
population, right? Population.
Yes,
yeah, that's what I assumed. Okay, just wanted to check. Thank you.
Yes, and in fact, yes, I'm going to answer that as yes for our clients. The number I just shared.
Leslie, you have your hand up.
Yeah, I have a clarification.
Mm-hmm.
When you said before that your people work with the homeless or the people in shelters and look to see whether they show symptoms, is there a programmed way of everyone that you come in contact with, that you broach the subject about vaccinations rather than just looking for symptoms?
So there's two different, that's a broad question because there's the shelter process and then there's the street homeless.
Either way, so if you could kind of translate that for me.
The street homeless process. And what I was referencing earlier was the street homeless outreach teams that upon engaging an individual on the street, they have a survey, a COVID-19 survey that they do to screen and to get a sense of this individual's health and well-being. They provide them with PPE, et cetera. Now the process as to someone, maybe Yvonne, you can speak better to this, of what the process is when someone's coming into shelter.
So when you're
Meaning.
So for clients that are individuals that are initially coming into shelter for the first time or been out for more than 365, they're automatically screened. Not necessarily, we'll ask them for symptoms, but we'll ask them universal questions regarding COVID, whether they've been exposed, whether they're experiencing symptoms. We offer them the opportunity to be vaccinated. For those that are agreed to be vaccinated, they're still assigned to a particular shelter, which is Uptown. It's basically a quarantine site where we have the clients stay in the rooms individually by themselves until the results of their tests come in. If a client refuses to take the vaccine, they're still sent to this particular facility where they will stay there for 10 to 14 days. While they're there, we have staff on duty that's going to continuously engage them, continuously do wellness checks to make sure that they're not exhibiting any symptoms, or to engage them around getting the vaccine and educating them and telling them the most, the important reasons of why the vaccination is necessary. For those clients that are in what we call program shelters, they go through the same type of screening when they're coming in. Their staff, a lot of our shelters, they take temperature readings. They are consistently and repeatedly spoken to and educated about the vaccination and the importance of the vaccination, especially since they live in congregate setting. We offer a lot of incentives. We've come up with, what do you call those? Like we do these little videos that we would run in shelters, thinking that maybe if they saw like one of their peers, if there was any hesitation, and if they saw one of their peers who got it and that person was fine. So we ask our providers to really focus in on those individuals who have not been vaccinated, and to just basically continuously to engage them around the vaccination. We feel that with more knowledge, more education, and when they see other people in the shelters that have been vaccinated, whether it's clients or staff, that have not been experiencing anything, they haven't grown a second head or anything like that, we feel that the more they see that, the more they will be willing to do the vaccination.
Lowell has a question.
Yeah, I agree. I'm going to echo what Joe said. I think the real way to increase the number above 30% is to actually go to all the shelters. But, from Leilani, what you said, that the hub is at 25th Street in Chelsea, and most of the shelters, the temporary shelters in our neighborhood are in Hell's Kitchen. Javits is allowing walk-ins at this point. Why are you not urging your clients to go to Javits to get shots, which is closer than to where they are living now than the DHS hub?
Right, or accompanying or setting up.
The word I was thinking, Joe, was field trip.
Yeah, exactly.
So Yvonne did express that we are going to sites. So we are going to sites to administer the
No, you're going. Lowell's talking about something different. You're going once a month. We have that. You have the mobile, right? But Lowell was mentioning that the proximity of Javits, for example, Yvonne, in this kind of work we all do, you offer a lunch or a meal or something. This is the strategies we all use to get people to engage with something. Is there anything that in these sites that you could arrange in order to get people, if you go, here we're doing a field trip and then we're having a great lunch or something like that, or I think, is that what you're asking, Lowell?
Yes, sir.
I will tell you that we have shared, there are a lot of vaccination hubs across the city. We have those in our sites because sometimes the client doesn't want to, for whatever reason, doesn't want to take it inside the shelter. We have listed all of the sites. We will give you a Metro card to get there, just to get the vaccination. We are continuously changing and developing new strategies to push the vaccination. There is, I'll be fully transparent, there is a lot of hesitancy around getting the vaccination. I think that, we have all agreed that the continue to educate and offer incentives, whether it's, we offer gift cards, we offer McDonald's, Wendy's, Metro cards. We have started asking our providers to think of a ambassador in our shelters who can push that vaccination, someone who is able to easily engage, someone who builds a relationship with the clients. I know, Joe, that that in this field, sometimes there's a lot of distrust. And sometimes it takes a while to build up that trust. Fully transparent with the vaccinations, in the beginning, a lot of people didn't want to take it. I'll be fully transparent and said I wasn't taking it at all either. But I think that over time, as you learn to educate and you find out other avenues and, the positive sides of these vaccinations, many people are taking them. I will tell you, when we vaccinate within our shelters, when we go there, if there are any leftover vaccinations, because our motto is, and our goal is to never have a vaccination, a dose go unused. So even at 6 o'clock at night, we'll get emails. Okay, this site has, 2 doses. This site has 1 dose. So we all push to get to get everyone vaccinated.
So I think if there's no other questions about vaccinations, let's move on to the plan. Can you begin to describe to us what is the plan for the return to congregate shelters? If in fact people are vaccinated, that is no longer anyone's responsibility except their own. Everyone has to take personal responsibility, and we need to get people back to locations where they can actually get real services as opposed to this catch as catch can model right now. Can we speak to what is DHS's plan to begin to relocate the density reduction hotels back to the congregate shelters? Either Leilani or Yvonne.
Sure. And so I have at this moment in time, the agency is working closely with CDC, State Department of Health, DOHMH, OTDA, and we're all essentially are being guided by the science to determine when we can return back to congregate shelter settings. And while we are planning for the return process, the actual timing and pace will depend on the overall health conditions in the city of New York.
So it is not a metric based upon the shelters, then it's a metric based upon the number is vaccinate. I mean, what is the metric for the city of New York that year? What are you using so we understand it better?
So we're paying attention to the health metrics citywide. Like we were warned that there would be a spike, an increase of COVID cases. I believe that was around flu season. And sure enough, there was a spike. So there was that type of advisement and guidance that we're getting, and the assessment that will be made and the determination that will be made, guided by science, essentially is scientific metric based on what is happening in the city of New York. The health indicators that we're paying attention to are not shelter site specifics or the fact that this is opening up here and there. We're paying attention to the overall health indicators that we're getting and the advisement that we're getting from health experts on what is safe for people who are living in close quarters, if that makes sense. We're talking about, right. Yeah.
So now we've gone from, as a city, to extremely high risk, to very high risk, and now in the last number of days to high risk, which means every indicator is bringing us down to a different point. What are the specific indicators that you are looking at so we can understand what is the trigger point when there is a comfort to have people return to the congregate settings? And you may not be able to answer that, or Yvonne, but if you can give us, can you really help us understand, because we understand that everyone wants to know what the time frame is, and you're saying that it's a condition. So if it's a condition, explain what that condition is.
I wish that I could just turn into a Bob the scientist, Bill Nye the science guy, but I'll have to circle back to share exactly what those health metric indicators are. Those are conversations that are being had on a top level, again, with health experts. There are around the clock conversations happening often, quite often. And I know we've been getting asked this question, and I know I've been circling back with this talking point, but I know it's frustrating for you all, for us to not have the answer. But I think that this is, again, a crisis and something that we take serious when we're talking about lives, people's lives, and moving them back into a setting where they're in close quarters with one another. And so I don't have the health metrics to share with you, the health indicators to share with you specifically, but I will see if that's something that we can get from our health experts and DOHMH partners over at the Department of Health. I'll see if they can share what those indicators or metrics are.
So what's confusing is the mayor at his press conference today announced that between July 1 and September, that the congregate shelters will be moved back to original locations. And we don't even know where that comes from, what it's based on. Yet you are here, unfortunately, tonight, letting us know that you don't have that particular details, but the mayor of the city of New York has said that's what's happening. So the problem is that you're an agency that reports to a mayor. There's a commissioner. We don't understand why there is not in May of 2020 and in June of 2020 and July, of course, there were no answers. This was all improvisation. We understand that, and we know how hard everyone worked. We're now more than a year, close to a year out. Every other business, organization, different schools, everyone has plans on how to deal with coming back and opening. We need to say flat out, publicly, the Department of Homeless Services needs to act to the same standard as other organizations, and certainly other city agencies. The city and the state are opening. We need to understand what's happening here, and there is beyond a deep frustration. And we're about to open this up to the public in a few moments, but I'd like to get to the committee members, anything about this issue. Questions? Paul, you're on mute.
Yeah, hello. Leilani, thank you for the information you've given us. Can I just ask you, can we assume, since what you just told us vaguely is that some 18,000 vaccines have been administered and the number of the total client base is roughly 60,000, it's about 30%. Can we assume that the same metric would be applied to your population as perhaps the mayor is thinking in his own mind about the general population? There's no reason why it would be significantly lower percentage of vaccines would not benefit from being repopulated to congregate housings. I mean, that's a safe assumption. Do you imagine that the metric used to actually move people back to congregate housing is going to be lower or different than the general population? When you say the science and the general population, I think the mayor is talking about a rosier picture of vaccinations in the general population. And it's my guess that the homeless population has a lower percentage of vaccination and is likely to stay that way for a while.
If you can't answer, it's okay.
That's okay. Yeah, I
want to say that honestly, because we don't want you to speculate about something, because that's not going to help.
I don't want to speculate. I can only speak to the facts of what I have and what we have and how we're operating. I hear the question.
Yeah. I'm sort of fishing. I don't want to put you personally on the spot, but I would like to establish some kind of a ground floor for our own mutual speculation and what would be a good best practice, which sounds like up the vaccinations, concentrate on taking the vaccinations to the people as we've just discussed, before we put them back in congregate setting where we could have their own spike and then we're back to where we started. That's all. Thanks very much.
Thank you.
Next committee member, JD.
Yeah, I have a question. First of all, Leilani and Yvonne, I'm sympathetic to the hard work that you have to do. Believe me. And it's maybe a stupid question, but what I don't understand, does every person in the shelters, temporary shelters in Hell's Kitchen, have to be vaccinated before everybody can be moved back?
So I'll allow Yvonne to expound, but it's just like any other citizen in New York City where it's an optional vaccine, right? The vaccine is not a mandatory vaccine, right? So
I understand that. I'm just saying, if there is one person that will not get vaccinated Does that mean people cannot move back?
No, I wouldn't think so, Yvonne, right?
I wouldn't think so, but once again, I want to just kind of mimic what Lalani said. We want to make sure that the bottom line for us is we want to make sure that our clients and our staff are all kept safe. Yes, the city and the state have opened up.
I understand, but I'm just.
I know, you just let me finish, but I think that when you say open up, we also, even with the schools open up, we have to take into consideration the difference when you're dealing with congregate setting. So, when you're in school, you might be together for 4 or 5 hours and then you're out. When we go into our shelters, they can, you're there, they live there, they eat there, and they all congregate together. So we have to be very careful, and we have to follow those guidelines, whatever, Department of Health or CDC has decided, or the state for that matter, on what would be the safest way for us to return to congregate settings, and at the same time maintaining that everybody is safe and there'll be no spike. As far as, does everyone have to be vaccinated before they can go into a particular shelter? We have not received guidance on that. It's probably unlikely, but we have not received any guidance.
So we should also note that
60%, if 60% are vaccinated, can people go back to their homes, or do you?
I don't think they have an answer, right?
I'm sorry?
Is that correct, Yvonne? I don't think you have an answer on this, right?
Yes, I can't answer that. We have not received guidance on that.
Right.
Okay.
So, and just to be clear, Maria and I have done research. CDC and the state have devolved down to the New York City. They're looking for New York City is the one making the decision. So the New York City Department of Health is the one that is going to make a decision here. And we need them to engage with DHS so there's some reality check as to what's happening. Are there any other committee members wanting to speak? And then we're going to go to the public.
Josephine.
Josephine, sorry.
Hi, Lalani, thank you for being here, and Yvonne. Lalani, earlier you had said in regards to the street homeless that they were assessed in terms of their overall health and well-being and to see if they had COVID or not. Are there any assessments being made to either street homeless or residents in the shelters about their mental health? Because we have a lot of issues of that going on now. So are these service providers or DHS, are there any requirements that the mental health of these homeless, does that have to be taken into account at any time? Like if this person is obviously needing some serious services, what's happening? And if there is no assessment being made, then why not? Thank you.
Sure.
Yvonne? Oh, sorry, Lillian.
Yvonne, did you want to?
Go ahead.
No, I saw her face move, so that's why.
Yeah, I'll answer, and Yvonne, take it away, because this Yvonne does this. She's a guru. She does this. She's been in the field in this administration and working for DHS for quite some time, so she can best answer this question. But I'm gonna try to take a stab at it. In short, the way it works on the street homeless side is very different from how assessments are made when individuals are coming into the shelter system. Those are two different universes and two different processes. When someone arrives to our doorstep via coming into intake, saying, I need shelter. When you're in need of shelter, you come through. If you're a single adult woman, there's an intake for women. If you're a single adult male, there's an intake for you there. 30th Street for men. Anybody coming into our intake system is assessed, and that information is captured through during assessment upon your intake into the shelter system. We then make a placement for you into an appropriate program setting. If you're employed, employable, we'll put you into a particular setting there. If it's a mental health needs that you have, we'll put you in the appropriate setting that can accommodate your particular need. So we match people based on the assessment that's made upon intake. And even then, when you come into the shelter system, there's nonstop assessments. You're constantly being assessed through engagement, through your interaction with staff or caseworkers, case managers. And they, you know, maybe they may have not captured that someone had a mental health condition initially upon coming into intake, but they're starting to present and show some challenges that staff may capture. And that's an assessment that will be made with staff, with clinicians, with case managers, and then it's flagged to DHS. They'll reach out to Yvonne, one of her program administrators. There'll be a conversation, a case conference around the individual, and then we'll make a transfer for that individual to place them into an appropriate setting based on whatever behaviors is being presented. So we're constantly assessing in shelter. And Yvonne, please jump in. I know
you did really well. It is true, when you come in through intake, you are, you know, we go by what the individual is actually self-reporting, and then you're sent to an assessment where the assessment process starts, and everybody gets a medical, they'll get a psych eval, a psych assessment, I should say. And it's an ongoing assessment while a client is in the system. We have individuals that come in and they will say, I don't have mental health. But then along that way, it kind of manifests itself somewhere down the line when they're in another shelter. I think when that happens, then we will refer you to appropriately, whether it's in a mental health shelter that has mental health services on site, or in a mental health intervention that's out in the community. I do want to say, though, you know, the pandemic has had people manifest a lot of different things.
It has exacerbated every condition. We are
yes,
very clear
and
about
it had really people who did not manifest any type of mental health issues, we're seeing that they are starting to manifest. We do refer out. We have mental health ACT teams that come to the sites and work with the clients. We have community partnerships with the providers where the provider can refer for mental health services. I want to stress, though, we are not an enforcement agency. We cannot force anyone to accept mental health services. You know, but when we see that there is a need, we will refer you. If someone's acting out, we will call 911 and have them sent to the hospital for an emergency evaluation. But once again, and we will sometimes with mental health, because the stigma behind mental health is such a negative behavior, a lot of people do not like to admit that they have mental health service issues, but the provider staff has been wonderful, you know, throughout this pandemic, coming to work every day and working with our clients. And it takes time sometimes. Once again, it's that distrust issue. So therefore, there's a level of engagement that sometimes it takes repeated attempts, repeated engagement to get that person to accept mental health services.
So Dolores is our last committee member. We have the public wanting to speak, and I want to make sure we hear them. Dolores, go ahead.
So ladies, my comments are about the agency, not both of you. And I appreciate the aspirational commentary that you're giving on your policies and your procedures. But what we witnessed in this community is none of that. Many of your providers are not good providers. And where you state that the importance or the goal is to ensure the safety of your clients, we were not seeing that the safety of the clients was being administered in many ways, meaning that folks were congregating, even though they were put in single rooms, they were congregating on the street. They were not protecting themselves, and by that, not protecting the rest of the community. We were not seeing that in action. And while I can appreciate that there's so many different sites around the city that need to be visited, we are not seeing that these shelter residents in their relocation sites were able to receive the services that they need. And we do recognize stressors occurred for all of us. And mental health is an issue that many of us aren't even grappling with right now. But the agency has to recognize that it has not performed well, and that its partners that it uses need to be looked at a little bit more closely, need to be screened better. And the sites where you've actually been able to put the congregate setting shelter residents are not appropriate. So if you don't have a plan, as every agency has a plan on returning back to quote unquote normal, you need to think about where people are in the moment and whether or not that actually provides the safety and that actually provides the services that they need. So I'm very disappointed in your agency, and I can understand you can say it was an emergency, but let's be honest. There was no siting for where your shelter partners ended up relocating. And that has created more of the stressors and more of the issues because people were too close together and too easily made prey by those that do happen to take advantage of those that are having mental health issues or drug issues. So if you can relay back to your superiors, the people that you report to, that if you don't have a plan yet for bringing people back to where they can receive those services, you still need to rethink about where they are now. And that's not just about this community, that's probably in other communities, because the hotels where they're put in, people are not being kept safe, despite the fact that that's your goal.
Let's go to the public because we need to get public going. It's been almost an hour now. Nellie, bring over Michael Noble and Christine Berthet. Mike, go first, please. I don't see Michael over yet, Nellie.
Yes, I moved him over.
Oh, okay, Michael, you're up. You're on mute, Michael. You're on mute, Mike.
Oh, sorry.
There you go.
Much of what I wanted to say has been said by some of the committee members. I just want to tell you that I too am frustrated by the fact that we don't have a metric that we can look to, and hope for. And the sooner that happens, the better. As far as an incentive goes, I don't know if it's ethical or what, but everybody's offering actual monetary incentives to people these days. And if you're down and out and you don't have much, I would think that people would scramble to get some sort of monetary incentive handed to them. The governor's done it, the mayor's done it, industries, businesses have done it. And it's not a bad idea. I mean, what do we got to lose here? I mean, the amount of money spent on a person in the first place is so great, a bit of incentive doesn't hurt. And it's better than the state ultimately saying to the people, you must take this vaccine. Don't want that, right? Want enough people to get herd immunity, and I think that's one way to do it. Just my suggestion.
Thank you, Mike. Christine Berthet. And then please bring over Nellie Bryan W. and Barrett A. Naugler. Go ahead, Christine.
Yes, thank you. Yeah, you have a very, very difficult job and you are not the one making the decisions. So take my comments with a grain of salt. But to me, it's incredibly simple. I mean, once people are vaccinated, they go back. That's it. You have 10 people in a hotel vaccinated, they go back. You have 20 people in another hotel vaccinated, they go back. And the decision in one by one, you are vaccinated, you just go back. That's simple. That's one thing. First of all, you are not paying as much money to the hotels, so you're reducing your cost. And second, we know once you are vaccinated, you can be in a group. So, and if you are in a group which is with other people vaccinated, why do we have to wait until some, very complicated standard? That's not the issue. The issue is, are you vaccinated and are you around other people which are vaccinated? Just like us in our houses, right? It's like we are taking the same way. So I don't understand why it's such a mystery and so complex. That's it. It's very, very simple. The second thing is about, I think something Lowell said or whatever is why don't you take every day you have a little truck or a little van taking 20 people to Javits, and you give them an incentive there. And you say, okay, and you know, so I don't understand. There is a simple, I mean, you just take a van and somebody driving and nothing else. It's fairly simple. So it seems to me that we are creating a lot of complicated rules where the simple rules should really drive. And it's a mystery to me, and I'm sure I'm missing a lot of things that I don't know. Thank you.
Let's go to Barrett and then bring over Christopher Santa Cruz, please, Nellie. Barrett.
Good evening, Leilani and Yvonne. One question. It would be helpful to understand the vaccination process. While it's very impressive that you've given out many vaccines, it would be helpful, though, to parse the data, to break out what percentage are DHS staff, what percentage are residents of congregate shelters, what percentage are street homeless, and then ultimately, what percentage of the vaccines given are to residents of the hotels. And that's really a matter of just taking your existing data and putting it through a statistics application. So is there a timetable at which you could perhaps release those statistics so that we could better understand what's going on? And then the DHS could develop a plan having this live data to when we might be able to see residents being relocated from the hotels. Thank you.
Brian Weber and then Christopher Santoro.
Hi, thank you, Joe. And I want to thank the committee for its comments. I want to echo a lot of them, in particular Dolores's. One thing that I've heard consistently is that DHS will be guided by science. The science right now is very simple. It's get vaccinated, and get vaccinated as soon as possible. So to hear that there are still barriers for people in shelter to getting vaccinated, providing them with the Metro card to go to another location offsite is not acceptable. Having them wait 4 weeks for their turn in shelter is also unacceptable. I mean, we need to remove any barrier for anyone in shelter who wishes to get vaccinated. And, you know, I applaud your programs to encourage people to get vaccinated, but it's got to be made much more easily and readily accessible. So there's that. The other thing that I have heard numerous times from DHS, and Leilani and Yvonne, you and I have been on calls for close to a year now, going back to last July. What I've heard, and I understand that it is the priority of DHS to ensure the safety of their clients and staff and the health and well-being of them. There's a big issue that is being overlooked here, and that is the community in which you've cited these shelters in. As I'm on this call, I'm sitting on a street that within 4-block radius has over 900 temporary shelter beds. And we all know the impact that that has had on the West 30s and Hell's Kitchen. We have heard of numerous assaults that have made a lot of attention in the media lately, where homeless individuals have assaulted residents on our street, and invariably they're unprovoked attacks by someone with mental health issues that most likely should not have been cited in a temporary hotel facility located between 2 transit hubs that draw an active street population. The stressors are too great on your population and shelter and on our street homeless population. And our neighborhood and our residents are the collateral damage in this. It is not safe to walk on 8th Avenue. It is not safe to walk on 9th Avenue. And overlooking this is really a flaw in the approach that DHS has taken. I know that you relocated a shelter through great efforts from West 36th to West 40th Street, and that did help somewhat on West 36th Street. But we're far from out of the woods, and the neighborhood is suffering. You talk about access to public spaces. Now that the weather's improving, now that more vaccines are available, well, I'm going to tell you about 2 public spaces on opposite ends of 36th Street. One is a park we affectionately refer to as the Canoe. This year, the Canoe, which is basically a traffic strip that has been landscaped between Dyer Avenue at the entrance to the Lincoln Tunnel,
and 9th Avenue.
And 9th Avenue has elected to not put out furniture this year for the community because it has attracted such an overwhelming amount of drug activity, drinking, and hostile behavior. So as a deterrent, the community has lost this park to go sit in. At the opposite end of 36th Street, in front of, I believe it's the Radisson on 8th Avenue, there is what is a privately operated public park, a POPS. The POPS in front of the Radisson had to take drastic measures and cover their furniture with plywood and cover the planters with plywood to try to deter the amount of drug activity there, to try to deter people from stashing drugs in the planters. And they were forced to remove it by the Department of Buildings. They were fined. And right now, that is an open air drug flea market. Now, I'm not saying that everybody there are individuals in these shelters, but a significant number are, and a significant number of other bad actors have been drawn to our location in Midtown, and we are feeling the impacts. So it is incumbent on you to bring back to your superiors at DHS that we need a plan. It needs to happen immediately. And quite honestly, I don't see how this community could wait till the end of the summer. It's getting warmer. There are more people on the streets, and we are seeing more incidents at an alarming rate, and it's only going to get worse. And quite frankly, the Department of Homeless Services in the city is accountable for all those assaults that are occurring on our neighbors at this point. So thank you.
Brian, just hold up for a second. So I just want to note for factual purposes that in fact, some of the assaults and some of the crimes have actually been clearly temporary shelter residents. We understand there's a question about street homeless, whatever, but the documented ones, as of today, for example, the issue on 42nd and 11th was a resident of the Skyline. So this is an ongoing issue, and we cannot ignore it anymore at all. Christopher, and then bring over John Chalice, Nellie. Christopher?
Thank you for having me in. Thank you. I'm actually a resident of Hell's Kitchen, Clint Housing, and I've been living here for most of my life, 35 years, born and raised. And I've seen, the neighborhood change throughout the years, and I get it when, you like the DHS had to do something when the pandemic happened, of course, like, guys, we need to do something about it and, put the homeless people into shelter in the hotels that weren't being used. But as time went on, it's just kind of like an eyesore. I'm walking 8th Avenue in the 30s, like 36 and up, and it's hard to see just people just shoot up right in front of you. And also on top of that, like the thing that happened on 43rd between 8th and 9th in front of that building. And I walked there, from time to time, but how like this man who I live on 40th between 9th and 10th, how this man lived up the block in that hotel and had this crazy criminal record. Like, I'm not trying to judge all the homeless people. I understand the plight. I too am all for mental health advocacy, but also there is an issue where the DHS needs to handle this properly, where there's an issue like, I see drug dealers just in broad daylight sell their stuff in front on 9th Ave to like the homeless people, and not just the street, but just, it just looks really different. And on top of that, I'm with my mom here. She's not here right now, but she actually suffered a fall and like fractured her hip. And we live on the 5th floor. And I can imagine like if she was to get better, yet she's still healing. And then all of a sudden, someone just attacks her. Like, I think about it, like sometimes I have to look behind my back nowadays, and that's not a feeling I'd like to have, and I know like times change, but also on top of that, I really, this really needs to be taken care of as soon as possible. Again, I do understand about, what the homeless people go through. I'm trying not to judge them, but also I'm always about working on the solution than focusing on the problem. How do we move forward from this, and how can we come together? And it's not only for me, but for all the residents here that live in Clinton Housing and Hell's Kitchen, because we want to feel safe. Someone just got jumped here not too long ago in front of the building too, but that's all I have to say. Thank you for your time.
Thank you so much. John Chalice, followed by Steve Chow. John.
Thank you, Joe. Leilani, Yvonne, it's good to see you again. Here's what I'm worried about. Yvonne, you were talking about incentives. And it sounds like you're offering Metro cards and gift cards and fast food, and that's great. What I'm wondering about is whether or not actually there might be a disincentive to get the vaccine if you think that once you've got it, you're going to have to go back and live in a congregate setting that you might not like as much as the hotel you're in at the moment, where you're one to a room. And I wonder how we address that. And I wonder particularly how we address that in light of what you've heard tonight. Dolores, amen to everything you said. You're worried about your shelter residents and your staff safety. We're worried about the community safety and our safety. And we have a tension here because we're not, as Dolores eloquently put it, we're not achieving either at the moment. But DHS is perceived as foot dragging. It is perceived as being a bit disingenuous in terms of what it's citing, non-transparent. And so what you're hearing is a lot of frustration sort of built up around that. We keep coming up with ideas. Joe has mentioned some good ones already about, can we get more frequent vaccinations on site, et cetera. I mean, but we just don't feel like we're actually making progress. And I'm worried that we actually may have a situation where people will be incented not to get vaccinated because they think it means they can stay in hotels that were not purpose-built.
Thank you, John. Steve Chow. Next is John Beck, and then Jennifer Malicote.
The DHS is paying the hotels $175 for each room.
Speak a little louder, Steve.
Okay. The DHS is paying the hotels $175 a room, while the market rate is only $90 a room. So that's a big waste of taxpayers' money. The city should discontinue those contracts, move those people over to the less expensive hotels. At least it will save the taxpayers some money. Now, Midtown Manhattan is your highest tax revenue generating source for the city. If you destroy that income source, none of your other social justice system is going to have any benefits. So it is primary incentive for the city to recover our resource, our revenue generating source at the minimum. That's what I have to say.
Thank you, Steve. John Beck, followed by Jennifer Malicote.
Hi, everyone. So I'm the general manager of the Crown Plaza on 36th Street and the Even Hotel on 35th Street. So to Steve's point, I have a $2 million tax bill due July 1st, which I don't have the money for because of everything that's going on in the neighborhood, which has been unsafe. I've been here every day through the pandemic, even though our hotel has been closed. And it's been unsafe and drugs, and I could buy crack right now. But my real comment is to the previous speaker. I have been at the hotel every day for over a year and have made a lot of friends with some of the residents in the shelters. And as I speak to them over the last month that the hotel's been open, I continually ask, when are you guys moving back? When are you guys moving back? And what I hear from these people, and these are the people in the shelters that are very communicative. I don't think they're causing any issues. Doesn't seem like they have any drugs or mental health issues. They tell me there's no sense in me getting the shot because then I'll have to move back. And so I know from the 5 or 6 people that I speak to at least once or twice a week when I see them outside, is they won't get a shot, frankly, because then they have to go back to a different setting.
Thank you, John. Jennifer, and then bring over Serge Harnett. Nellie? Jennifer? You're on mute.
Hi.
There you go. Got it.
Somebody kicked me off I was on my computer and I've been kicked off that part of it. So I would like to welcome back Leilani, because I know Leilani, I've worked with her for a couple of years on some issues related to this. And I think that she has compassion and a heart, and she does a great job. And, you know, it's a difficult and complex situation to deal with. And I'm glad to see everybody back at the table after a couple of years of not being at the table. And I'd also like to welcome everybody back at the table, including people like Brian Weber, even though I have difficulty speaking to you because you have such a segregated.
I would ask that you confine your comments.
Let me say what I want to say.
No, I would ask you to confine your comments to the issue at hand and not to speak about other people. Thank you very much.
The issue at hand is we have a homeless community, not homeless people. They're part of our community and they need to be cared for as well. And there's going to be a larger homeless community and a larger segment of our community that is low income and has trouble seeking housing. And as the community, we need to come up with solutions for this. We need to not speak to them about outsiders and bring them into our community. I have had a lot of luck by talking to people in my neighborhood, talking to drug addicted people, talking to people in my community. I've had a lot of a lot of success of actually bringing people into services. It's disheartening to me the way that you speak about people in general. We're all of us are literally like one step outside of being there. Like anything could happen at any time, and then we no longer have housing or shelter. I would embrace our community. I would bring our community together, and I would welcome the not being so divisive. And I'm also going to ask at this time, I have relationships with Leilani, with Christine, with Maria, with John Mudd, which he definitely should be on this call. Brian is an agitator.
Okay, I'm going to ask you again.
I would like to listen, but listen to what I'm saying. I would like us to come together as a community.
To speak at hand. Thank you.
All
Let's
right.
go on. Okay, sir.
So you don't want to hear anything more of what I have to say?
No, I'm asking that.
Leilani, Maria, everybody that knows me, please reach out.
Thank you very much. Let's go to the next Serge, followed by Dana LaBelle.
Hi, I'm just unmuting here. I just want to pull up something that I was putting together today. I know a lot of you have already discussed this, but let me just pull this up. Could you go to the next person and then I could come back? Is that possible?
Dana LaBelle, we'll come back to you.
Oh, perfect. Thank you so much.
Right.
Hi, good
Dana.
evening. So I'm sorry, I decided to speak just on a whim, so forgive me if I don't sound 100% great. But I am a member of the community in Hell's Kitchen. I absolutely love living here. And I wanted to say that I find it unacceptable that as a community member, I have no idea what we are doing from month to month to help people who have mental health needs in our community who are living in shelters. My husband, and I'm sorry if I'm getting emotional, was physically assaulted. My husband, who is a doctor healing people with his hands, was physically assaulted on his way back from work. And the person who the police, and I quote, said to us was a local man from a homeless shelter who clearly was not getting the mental health supports he needed. They acted as if this was a normal day for him. It was not a normal day for us. My husband's face was broken. He was already a traumatic brain injury survivor. And thank God he's doing okay right now. But it is not acceptable that we have to go through this, that when I take my dog for a walk, I have to look behind me in my own neighborhood. I'm sorry. I have to say it because we are talking like, some people are talking like this is a thing that is distant, but this is very personal to me and to anyone else who has been a victim of an assault because of what is happening. So I demand to know what is going on in our community and to know what the next steps are to help the people who need the mental health supports as immediately. And that's all I'm going to say. Thank you.
Dana, thank you very much. Going back to Serge, followed by Kirk Gostkowski. Serge?
Yep, I'm ready. Joe, thank you for everything. And hi, Liana and Yvonne. And thank you for showing up when no one else from DHS had the nerve to. I just want to say something, just let's talk facts. We have been told for so long that there's no connection between what's been going on in the homeless shelters and crime. And I just wrote this down and went through it. I was looking at all of the stories. And both Brandon Elliott, who attacked an elderly Asian woman on her way to church, and Lloyd Ravel, who punched and bit an elderly Asian man, were staying in hotels serving as homeless shelters. I think we're starting to understand what DHS has been telling us is not true. Many of these residents are mentally ill, ex-convicts, mostly in Hell's Kitchen and Midtown South area. There are too many homeless shelters clustered together, and we all know this. The summer months, this is what concerns me. This has to be done quickly because the summer months, as Brian had mentioned, are fast approaching. Currently, many of these hotels are visited by 10 to 15 police and 1 to 2 ambulance visits per day. I'm informed that one facility on 29th Street has an almost 30% increase from March to April in police and ambulance visits. The point is, I don't know how much time we have here. I'm sure there are so many people on this call that I've invited, and I hear Dana's story every day, and you feel helpless in this. And I don't see how a mentally impaired person who's suffering from dual diagnosis, which is a combination of drug addiction and mental illness, this is documented. These people are wandering around and they're being released to the public. And it's very, very dangerous. And I just want to say this is how urgent this is. Thank you for everyone putting this together.
Kirk, followed by Sabrina Ravon.
Hi, everybody. I want to thank you for listening to me. I'm Kirk Gostkowski. I'm the artistic director of the Chain Theater. We're at 312 West 36th Street between 8th and 9th Avenue. As we return to try and reopen, we are experiencing what the residents of this block have been experiencing for the entire year. I want to acknowledge that this is a really, really complex issue that is way above my pay grade. But all I can really testify is to what I've been experiencing here on a daily basis for, I don't know, really, that we've been here regularly for the last 6 months. We very much feel like we're on our own a lot of the time. It's not a matter of a site issue. It's a matter of a public safety issue. I feel unsafe here on a daily basis. My colleague was followed leaving here and shoved and repeatedly, and luckily I was there. And that woman ran into the shelter that's on 37th Street because we were walking to go get supplies as we try to rebuild and reopen here. We were spit at on the street. We have to chain the front doors of our building shut to make sure that people don't come in and defecate on the floor in the lobby, which happens anytime that the building is open in a late night process. So one of the few things I can legally do right now is my business is just starting to be able to reopen because we are a theater, which means that, you know, people getting together is our business. And we haven't been able to do that. So we've been holding classes. We've been able to be open for classes. And we have children coming to the classes on the weekends. And they are experiencing what we've been experiencing here of people shooting up in front of our building constantly, of harassment, of being followed, of it's, you know, as a business owner, it's very hard because, you know, as a person, I'm extremely compassionate and, but as a business owner, I don't know how I'm supposed to pay some of the highest rents in probably the country and be shut down for a year with no help from the city. And now we have people camped out and setting up tents and boom boxes, and there's open drug dealing. And if anybody's ever seen The Wire, the television show, that's what I experience on a daily basis outside of our building. All I have to do is look out the window. There's runners that run to the hotel where the homeless shelter is, and they know when the police are going, and they run and they alert everybody. It also, there's so many people that I've met that live here that have been assaulted. And as I've now said to the city council's office, as I've said to the police, it's not a matter of if, it's how many people need to be hurt before something's done about this. And I'm so sorry to hear Dana's story too. I don't have any solutions, but I just, I'm fighting here to survive with this little dream we started 10 years ago. And I can't go through a summer of this. People will not come to my business if this is what they have to see every day and step over people and be harassed and shoved and threatened. And I'm very scared for my personal safety. And I think I have a right to be. Thank you for your time.
Thank you, Kirk. Elaine Korn and then Alan Marchetti. Oh, sorry, Sabrina, you're next. You're next, Sabrina. Yeah.
Good evening. I want to comment on a few things, and I myself been assaulted twice. And recently I witnessed one with Maria. We were just standing, you know, it's 4 o'clock, 9th Avenue, and the guy just came in and just abruptly wanted to touch Maria. I mean, we all witness what's going on, and it is a public safety matter. And I mean, I work for social services, so I have a deeply understanding of the issue, and how hard it is. However, I think there's a problem when the bigger problem here is like, okay, so we have these folks that they don't want to get the vaccine, so they don't have to leave those hotels because it seems like they have a better quality of life, these hotels that they have in the shelters. So I think we have to ask ourselves, so what's happening with those shelters? Why they don't want to go back there? So I think that's where we need to really refocus the energy. And this is a bigger conversation for more than just for us. This really starts from the city administration and why these people don't want to go back to those shelters. What is going on with those shelters that, you know, obviously now is being refocused and recentered because what happened with COVID and the terrible way that they handle it with social distancing and pandemic. But this is a backstory. And I think that's what we need to really focus on.
Elaine Korn, followed by Christine Gorman. Thank you, Sabrina.
Yes,
Elaine
hi.
Korn?
My name is Elaine Korn, and I come from 1 block away from CB4. I'm part of CB5, and Brian Weber was kind enough to tell me about this meeting, and I'm very glad to be here because it makes me and the people, I'm on the board of directors of a small building on 35th Street, and it makes me feel less alone to hear your plight, and I really have compassion for both sides. I have seen a lot of people here in other meetings before. And it's very distressing because everyone here is living in the problem, including myself. Our doorman was assaulted. I walk in the street in fear. I have moved out of my apartment for a number of months. And when I came back, a homeless woman threw apples at my head. And when you walk out of my building, it's like Fort Apache. And I don't know what the solution is, but I do think that if we all keep talking amongst ourselves about how horrible it is and we can't get to the right people, I understand because I've seen Leilani from DHS at other meetings, and I applaud you for going to those meetings. And Yvonne, you seem like a lovely woman, but you're not helping us. And I have to say that candidly. And it's hard for me to say that because I'm a people pleaser. I don't like people to, find fault with what I say, but it's not enough. If Mayor de Blasio is saying that he's going to do this, he's not telling the truth. I think that the answer comes from going to the mayor's desk, to going to the people who are higher up, because obviously the people in this meeting are you're all wonderful people. I particularly have so much compassion for the homeless and for the woman whose husband was attacked for no reason of his own. And I have compassion for the mentally ill. I mean, I feel like I could become mentally ill from the situation. But we are not living in a solution here. And I feel like if we don't, the next step is, what are we going to do? I mean, when I hear the statistics about the vaccine, there's no reason for anybody in the shelter system to get the vaccine if that's the case. Anyway, I don't want to be rambling, but I'm very thankful to be here.
Thank you, Elaine. Alan Marchetti, followed by Christine Gorman.
Hi, can you hear me?
Yes.
Thank you, Joe. I want to say a special thank you to Dana Lobel, who mentioned about her husband, who was a physician who was attacked. I'm a physician who's lived in this area for over 20 years. And until now, I've been embarrassed to say that I've been attacked twice in the past year, both by homeless people. Around the corner, I was shoved and pulled and my wallet taken, and I followed the person, and he went right to the building next to me that was a homeless shelter. And I was very embarrassed as a doctor to be talking about this twice, because I thought it wasn't right, because the homeless have their own issues. But thank you, Dana, for mentioning that, because I understand how horrible it is to be a person or a doctor in this area caring for these people. And when they attack you, it's like, how did these people become my enemy and not my patients? And I really have been embarrassed even to talk about this until Dana mentioned this tonight. So thank you. That's a big deal to me. Anyway, I do have hope that Leilani and Vaughn will understand how important it is to move these people out of here. It has destroyed this neighborhood. I've never felt so unsafe. I've never been assaulted in my entire years in New York City, and I've been here since the late 1980s, up until this past year twice. I had hope that things would be happening. This past week, when I went to work, I was behind two people that were leaving the shelter, and what John Chalice and what John Beck said, I actually heard. I couldn't believe it. Neither one of them, they were talking about getting the vaccine. Neither one of them wanted to get the vaccine because they would have to leave the area. Something is wrong with what DHS is doing. DHS destroyed this area, and now how they're implementing their strategies is not even allowing these poor homeless people to want to get the vaccines. I mean, come on, Leilani, come on, Yvonne. I mean, look at the picture. Look how much destruction has been done. How many people have to be hurt? How many young doctors like Dana's husband have to be hurt, or older doctors turning 70 in a few years like myself to have to be hurt before DHS hears our cry? The neighborhood has been destroyed in the past year. That's my story. Thank you, Dana, for opening up your story and allowing me to open my story. And DHS, will you please just help us? Quit the metrics, quit all the BS, and just help us. And at the same time, you could be helping these other people. Thank you.
Thank you.
One more last thing. Some lady here said something bad about Brian Weber, who happens to live in my area. He has been a godsend. He has been absolute godsend. So whatever lady was talking about Mr. Weber, she is wrong and doesn't understand anything. Thank you so much.
Thank you. Let's go to Christine Gorman, followed by Devin Brooks.
Hi, I'm Christine Gorman. I'm president of the West 55th Street Block Association. Thank you, Leilani and Yvonne, for spending your time with us. I have a question, a factual question. I heard something about FEMA money being used to pay for the hotel shelters. Is that true? It's my first question. And secondly, FEMA money usually comes with an end date. When is the end date? Thank you.
Leilani or Yvonne?
I don't have an answer for that question, but I can circle back to the community board with answers.
Okay, Yvonne, any information about that? If FEMA funds are being used for the shelters?
Same as Leilani, we'd
Same.
have to circle back with that information.
Okay. So we'll hear about that very well. We're gonna, but you will find that out, right?
Yes.
I'm not saying you know it now. Okay. Devin Brooks.
Hi, good evening, everyone. Devin. I live across the street from my college, John Jay College, and I currently serve in the Student Government Association in my senior year of my undergrad. I've just noticed, people were talking about the shooting up in the streets. Well, earlier today, I know that I live around like a few density reduction sites from my personal research. I'm accustomed to walking past my school and asking someone not to shoot up in front of my school. And normally these people I don't recognize from my neighborhood. And I think that was important. Also, I worked with the Census Bureau this past summer, and I surveyed the homeless in DeWitt Clinton Park. And, it's not too far from my home. And it's also not too far from like the Skyline area, you know. My favorite library on 10th Avenue, which is not too far from the Skyline Hotel, it turned into like a public urination site, and I understand that the city is still closed and we're still trying to get back. But what I really feel is that if the DHS can really try to incentivize people to get vaccinated and wanting them to come back into the shelter, that would be great.
Thank you, Devin. Any other members of the public who would want to speak this evening?
I have a quick question for Devin.
Go ahead.
Can you please share the address that you're referencing, the area that you said smells like
Urine?
Yeah.
Okay, so the New York Public Library,
It's
Columbus.
the Columbus branch, right?
Right. And that's my home branch, because if I don't go there, I have to go to Lincoln Center, but Lincoln Center is not it's not always convenient for me. But
Leilani, between 50th and 51st on 10th Avenue.
Between what?
and also
I'm sorry.
I just wanted to say one more thing.
Go ahead, Devin. Go ahead.
Store too. The convenience store too. I mean, I was born and raised in the Bronx, so I know what these type of behaviors look like. My thing is that the type of behavior that I ran away from living in the Bronx, I now see at that street corner that street corner bodega next to the library, which is within the same area of the Skyline Hotel. And sometimes I have my nephew. I might bring him to the library with me if it's open, so that way I can study and then he can read books. And I want that area to be a little bit more safer. So if we can incentivize having these homeless residents get their vaccinations and go back into congregate settings, it would help the community a whole lot.
Leilani, just for information, it's the east side of 10th Avenue between 50 and 51. That's where the library is, and then the bodega's on the corner.
Thank you.
Any of members? Barbara Blair, followed by Barbara Connect. Bring Barbara Blair over and Barbara Connect, please. Nellie? Barbara Blair, you're on mute. There you go.
Hi, I'm so sorry. Leilani and Yvonne, thank you so much. And you've done a Herculean job in terms of taking care of the community that you're charged with taking care of. I think what happened in this emergency situation is a different community was sacrificed for this community. And what I would say is, from what I read in the New York Times, who knows, that in the NYPD, only 35% of NYPD have taken the vaccine. The United States military, something like only 40% have taken the vaccine. Now I'm hearing from some of the community members on this call that it never occurred to me there was a disincentive to take the vaccine, meaning that you like living better where you are than where you were. And so Christine had suggested that as people take the vaccine, they be moved back to the congregate setting. What I would say is there's a huge amount of distrust in the nation about taking the vaccine. We're only at about 50%. And so this plan, although in an emergency situation may have made sense, it's possible that these folks will never take the vaccine, like many, many communities throughout the United States of America. So what I would say is you need to go back to the commissioner and you need a plan B. Let's say it's not going to get any better than 30%. This is it. People are suspicious. You know, it could be 100 reasons. And I think the commissioner immediately needs to come up with a plan B, which may be, if you're vaccinated, you go back to a congregate setting, or, okay, we created this concentration because there was uptake on the part of the hotels in this neighborhood, but we can't have this kind of a concentration near transportation hubs and where there were pre-existing conditions. And so now we need to decentralize the population. And for the folks that are not taking the vaccine and may never take the vaccine, they need to be redistributed. It sounds like you're talking about goods. I don't mean that. They need to be resettled throughout the 5 boroughs of the city of New York in other hotels or other settings, because maybe they'll never take the vaccine, but you cannot have a concentration here, the concentration that you created, which, as Kurt said from the theater, I don't feel safe. I'll tell you why, Kurt, you're not safe. You are not safe. Crime has gone through the roof. We talk to the chiefs of the police on an almost weekly basis. Crime is through the roof and is directly attributed to the situation that was created by the use of these hotels. So I'm asking that you deconcentrate immediately the vaccine, notwithstanding, because it's possible they won't ever take the vaccine, which is reflective of the nation.
Joe, can I follow up on that?
Yeah, sure.
I was going to say something similar to what Barbara said, but it's actually the opposite. I think that what we're hearing anecdotally is that the populations that DHS is serving do not want to take the vaccine because they think they get to stay where they are if they don't. I think part of what has to be made clear, and part of the reason we need to know what it's going to take to move people back to congregate settings, is that this misnomer that if I don't take the vaccine, I get to stay where I am, has to be, put to, the lie has to be told. If what is going to happen is, as Leilani, as you said earlier, that it's going to be some kind of citywide metric that we need to move people back to the shelters, then the homeless population has to be made aware of this, that whether or not they individually get the vaccine is going to have no effect on what they're doing. And that can be, you can solve that by telling us what it's going to take. And then it puts, once they realize that it's not going to make a difference whether or not they get the vaccine, maybe that disincentive goes away and the vaccine numbers go up.
The only other thing I would mention on this line is the whole rest of New York City is opening up. Museums, theaters, everything. You can't guarantee that everyone has a vaccine. You could send people back to the congregate settings. And if you have a vaccine, you're on this section, like Yankee Stadium. If you don't have a vaccine, you're over there on that section, and there's screens or whatever. But all I'm saying is you need to come up, please tell the commissioner, with a plan B, because we could assume that maybe this is it, 30%, and it can't stay like this because you have a whole community that is tanking and it's dangerous and people, and the crime is untenable.
Barbara Connect.
Thank you.
Thank you. Thank you, Barbara. Barbara Connect.
Thank you. Lalani and Yvonne, I feel for you. I was in your shoes in the 1980s. I worked for Homeless Services during the Koch administration, and I actually had to have police protection at a public meeting in Queens. I don't think that's what you're experiencing here. At that time, I was charged with convincing neighborhoods to accept people experiencing homelessness into their neighborhoods. I knew that with management, it was possible to integrate people into established neighborhoods. I've lived in Hell's Kitchen since 1988, and I am proud of its commitment to living alongside everyone. I know how hard this is, but it isn't acceptable that all these years later, we have this problem. We have a commissioner at DHS, a former advocate who challenged city policy for decades before becoming commissioner, but he seems unable to persuade a mayor who proclaimed to be an advocate to manage this situation. This is a management problem. They are failing so significantly to serve people experiencing homelessness. I constantly think of the challenges to solving the situation that people are describing, and I also know it is possible to improve it. It is a management problem, a service support system. My question is, what will it take to get the mayor and commissioner to hear what you are hearing?
So any other members of the public want to speak? I would like to sort of sum up where we are today a bit. And again, we have all had differences, and I say this to DHS, and we've spoken very directly and very forcefully to you. None of our response is about you, the individuals. There is a monumental failure by DHS on how this process was managed. Not at the beginning, you improvised. God bless you all for doing it. This is my 43rd year in this neighborhood, and you have shredded our neighborhood fabric. That's what it feels like. No one feels safe. From every different angle, no one feels safe. And I will say to you, not anecdotally, but from my witness, my eyes and my ears, I hear people who are living in shelter on 36th, 37th, and they are folks who have severe mental illness. They are not getting services, heavy addiction, congregating together. I witnessed something yesterday that I never thought I would believe. A man in a wheelchair with a recent amputation being fed beer while someone else shot him up on my walk home. I know the man in the wheelchair. I've seen him as a street homeless person. The other folks are residents of shelters. The connection of everything together is creating an absolute, it isn't a nightmare. It's a lack of basic human safety for the clients and for us. I know it's hard to hear it. You've heard a lot of different stories. It's a range of people that speak. Sometimes we think it's just going to be, oh, these long-term people who are just annoyed. No. Prior to this, we lived in a neighborhood that had gotten safe over decades. The public safety is gone. People are scared. And we need you to hear us. And I'm trying to reach deep inside to the two of you to bring this message back from every different level. We can't continue. And I am scared shitless as the summer arrives. I am scared. Maria was actually grabbed by someone. She has worked diligently for our board and our neighborhood with you directly to help make this better. I have had people in my face screaming at me. This is not help. We can't do it anymore. And the assaults are getting more violent. Can you please take this message back? You can tell us that you can do that, not fix it, but you can take it back so you can just be a witness to what we are living with. That would be a very helpful sign to us. So if we could end on that and just give us a quick, I mean, you heard a lot. I know you can't fix everything, but from Leilani and Yvonne, I know it's hard to hear, but can you just give us some response on that?
Absolutely. First of all, thank you everybody who shared your stories. I know many of you, it's not always easy to open up and express in such a vulnerable way your experiences. Never will we discount your experiences. Those are your experiences. And I'm really sorry to hear about the tragic experiences that was shared on tonight's call. I absolutely will take this feedback to senior leadership. At the end of these types of meetings, I always send what we call like a readout of the meeting and share it with leadership. And I'm absolutely going to incorporate these narratives that was shared tonight. And in working really closely with you all, I'm familiar with a lot of the residents that expressed and shared stories tonight. I will definitely take all of this back up to our leadership. I just want to make a point about something that I kept hearing resurfacing all night about clients not wanting to take the vaccine because they can stay. That's a first. And I don't think, you know, we've never heard that narrative. And I don't want to run with that I don't want folks to walk away thinking that because that may be some individuals' way of thinking that dictates our process on what returning back to congregate shelter settings will look like. You know, that's a new narrative. And, you know, we will obviously, again, follow the science and whatever is advised, whatever the recommendations made to the agency, whatever that is, we have to abide by that and not by anything else.
But at least you know that like that sound is out there. That may help you understand the psychology and the issues happening outside of the science.
Yeah, and I think you know, I think that that's something that I hear even from individuals who are not in shelter. There's some, you know, concerns around wanting, you know, some individuals wanting to accept the vaccine, but I definitely hear where folks are going with the psychology, with making that point. But just expressing that the agency is still going to move forward and do what we have to do when we return back to congregate shelter settings. And whatever is safe, of course, we're thinking client and staff safety first always, is what we will do. So I will take this all back. And again, you know, I'm sorry. I'm sorry for the experiences many of you all shared with us this evening. But I do want to also say it's very important. We're always going to continue to work with our partners, our partner agencies. It's always going to take a collaborative effort to make sure that we're being a good neighbor and community, but, you know, working with our other partners that can help ensure that, you know, safety is implemented. And, you know, our providers, we do rounds. We have them doing roves in the area. I'm going to flag some of the locations that were shared with me tonight. I do want to ask a question to Kirk, the business owner who operates, I believe he said a theater. He has a business, but I would like to get his location, taking some of those locations, jotting them down so that our street.
It's 312 West 36th.
312 West 36. Yeah, so I have my notes. I'm definitely going to flag some of the locations that was expressed and shared as a point of concern, and share it with our providers to make sure they're putting eyes to those areas, in addition to our street homeless outreach teams to make sure that they're putting eyes to those areas as well, and seeing what resources can be allocated to those locations. So with that, you are heard. And I do appreciate you all expressing tonight to us. We will take this back for sure. What you don't know is I'm the very vocal, and definitely will take and express your narratives in the way that you did tonight and convey it back to senior leadership.
Leilani, thank you very much. Yes, JD.
I want to make a motion.
Okay.
That we thank Yvonne and Leilani.
One second. You're breaking up, JD. We're not getting all the words.
I want to make a motion that we write a letter from CB4 suggesting that our electeds resign now. That includes Corey, Brad, the Rosenthals, Dick Gottfried. This situation has gone on for a year. I suggest we send them a transcript of what we heard tonight. DHS is an agency that does what it's told to do, and they do it well. But our electeds are supposed to mediate between the city agency and our community. They have failed us, not DHS, but our electeds. And I know Lowell's here, and I know it's ridiculous for the community board to send a letter suggesting that they resign, but I'm furious. This is unacceptable after a year.
And
we can't keep beating up on DHS.
Right. And Yvonne, I want to direct one thing to you from your end, is that what's the unintended effect of this also is our community has always been very welcoming to social services and supportive housing. And it has turned large sectors of the community away from being welcoming to this experience. And that is one of the saddest things for me, because we are an integrated community that connects and has compassion and empathy, and we welcome things in. And the fact that we are at this point because of the management issue and the effects means that it will be very hard to get anything brought here again that has social services attached to it. I can tell you that it's really a shocker for me to see the major sea change. So if you can bring that message back to, that'd be very helpful. It's really a shocker. I think we have now at 8:30, we've been at this for 2 hours. We have 2 other items. I think.
So that is a motion that JD did make.
Right. So the motion is that everybody resign. I think is that a real motion, JD?
I thought it was a joke.
I'm not so sure it was a joke.
You're on mute. You're on
JD,
mute.
you're on mute.
You're on mute. I can't hear you.
All right. I think we need to write a serious letter from this committee of what we've heard tonight.
Right.
And we can't rely on DHS to suddenly solve the problems. Our politicians, I think we should embarrass them. I think we should do it publicly. We don't do that as a board. We try to work together, but they are not working with us, Joe.
Yeah,
I second that motion.
Yeah,
I second that motion.
Got it. I think it is material that we write specifically to our elected officials that there has been no advocacy for the community. There is a huge homeless population and a client need. Well, we have a community need too. They need to be balanced. And where we are right now, we need to make sure we survive this summer. So I think the idea of detailing everything, we have the recording. It helps just lay out what again we heard, because we've had many of these meetings before. All those in favor of a specific
Joe,
motion.
Joe, can I ask for clarification before you call for a vote? Just who is this letter being addressed to? Is it being addressed to Corey? Is it being addressed to de Blasio? Who are we addressing this to?
I think we are addressing it to our elected officials to hold the mayor accountable for the consequence of these actions. Is that correct, JD?
Yes, it is. And calling all of them to resign.
I'm not. I think we should, that may make us feel good, but not going to get anywhere.
Okay, I'll accept that.
So, and again, I want to say to the 2 DHS reps, you are in the crappiest, most untenable position. I know it's your job. I know what you have to do, but this is very, very hard for all of us. So we thank you for just listening and engaging with it. We really, really thank you.
Thank you.
Yes, there you go. So on JD's motion, all those in favor, committee members, please raise your hand. All those opposed? All those abstaining? It is unanimous. All right. Thank the public very much. Thank you all very much. And now we have a yes.
Yvonne and Leilani, thank you so much for being here.
Thank you for having us. Thank you for sharing your experiences.
Thank you. We're moving on to our next item, which is a presentation by Ted Houghton from Gateway Housing. And it's a specific follow-up to discussions that the community board has had about creating a policy about conversion of hotels or office space to both affordable, supportive, or homeless shelter. And there's a lot of specific things. And Ted, you clearly are following a very complicated, difficult discussion. So if you can introduce yourself, talk about what your thoughts are, and then your reaction to some of the information the board has put out.
Okay, guys, stop. Hi, everyone. Wait, okay, let's see. Are you guys hearing me?
Yes, we are.
Okay, good. Hi, everyone.
First, thank you for waiting.
Yeah, no problem. I've got a burrito that's waiting for me, but I'll get to that. That's what community board meetings are all about, right? Anyways, I'm Ted Houghton. I'm the president of Gateway Housing. We advise government and nonprofits on ways to create better types of housing for formerly homeless people. And I've spent a lot of time in the last year trying to figure out ways that we can turn hotels into permanent affordable housing rather than into shelters. I think that, you know, like most of you, I think that permanent housing is the answer to homelessness. We have a right to shelter and we need to address housing emergencies, but we should be doing all we can to reduce the size of the shelter system and make shelter stays as brief and temporary as we can and get people into permanent housing with services on site if necessary to help support them. And we have done this for years and years, and Joe Restuccia and many others have created a lot of permanent affordable housing and permanent supportive housing with services on site for formerly homeless and low-income people. But we're building it faster than we ever have. We're creating 1,500 new units of supportive housing every year. But we're never going to build it quickly enough to get to make a significant reduction in the size of the homeless shelter system. We've got to do more. And the sudden distress that hotels are experiencing because of the pandemic provides us an opportunity to buy these hotels and convert them into permanent affordable housing in a volume that we haven't been able to do with just new construction of supportive housing. It's a sudden market change, and that happens from time to time, and it provides an opportunity because we can't afford the prices of hotels to turn them into housing normally unless they're in distress. So the macroeconomics are sound, but it's difficult to implement this. Hotels, you know, the hotel stock was overbuilt before the pandemic, according to some, that there was more hotel rooms than we needed in New York City. Occupancy is down significantly now. However, you know, some hotel owners are starting to see a light at the end of the tunnel, and many hotels will survive, and that's a good thing because tourism and business travel is an economic driver in New York City, and we should be preserving that as much as we can. What I'm talking about is really operating around the margins of the hotel stock and to see what we can do to grab as many units as we can to create housing for people who need it. I'm going to talk a little bit about the housing stock that we have, the hotel stock we have. You know, most hotels are in Manhattan. There's about 460 hotels in Manhattan. There's only 32 in the Bronx. You wouldn't, you know, that's what I think everybody would expect. There's only 13 in Staten Island. Brooklyn and Queens, there are a lot near the airport. There's about 800 hotels citywide. They have about 150,000 rooms between them. And these are, according to the Hotel Association, about 20% of those hotels are not coming back. And so what are we going to do with them? We don't want to see the disinvestment and abandonment that we saw in the 70s. We should be proactive and try to repurpose these buildings before they become blight and start dragging down the neighborhood. Hotels are zoned commercial, residential, or in light manufacturing districts, most in commercial and residential, and those can be turned as of right into permanent housing. Hotels, the 200 or so hotels that are in light manufacturing districts would need to be rezoned in order to be turned into permanent housing. All of these hotels could be turned into shelter overnight, as you've seen. And I think that that's, generally a bad idea. I was pleased to see Yvonne Ballard here today. She's a great public servant at DHS, has been working on this issue for years. And DHS has a really hard road to hoe here, in that they had to move people very, very quickly to get them into safe environments as a result of the pandemic. However, the concentration is just untenable, and I'm really familiar with what CB4 has been going through with this relocation and the sudden influx of so many people. And I'm glad you guys had a chance to express your concern today to DHS. I hope it goes up to the top, to City Hall and DHS leadership. So those hotels are all over the city, you know, they're, you know, most will come back and will exist as tourist hotels, particularly the larger unionized hotels. I think all of those really, they're going to survive. Some will be, you know, a couple of them will be closed and turned into apartment buildings or something like that. But new ones will come up as tourism demand returns. I think that business travel may never return to the level it was at, because we've all gotten used to having these meetings on Zoom. But I'm hopeful that, you know, we will once again have tourism. You know, it'll probably take 2 or 3 years, maybe 4, but hopefully that will come back. But it's hard to look into the crystal ball and know for sure. There's a lot of challenges to converting hotels to permanent housing. Owners are generally reluctant to sell. Most families, they're family owned, and they're buy and hold families that own these. Lenders are reluctant to foreclose. They don't really want to own a hotel in this environment. The DHS subsidies, using these as emergency shelter, have been a lifeline for a lot of hotel owners. And the zoning and other building code issues may restrict conversions. The pricing is unclear. I'm seeing prices starting to go up, and we haven't had the resources to go out and really help nonprofits buy hotels to convert them. It just hasn't been there. The resources that are there, there's a bill in Albany right now called the Housing Our Neighbors with Dignity Act that is introduced in the Senate, and a companion bill was introduced in the Assembly, and they're debating it now. It has $100 million that was passed in the state budget a couple months ago that would be used as capital to acquire hotels. The program parameters are being debated right now. There's a lot there that will protect union hotels, make sure that hotels in industrial business zones are not converted into housing, and to ensure that the units that are created have kitchenettes and individual bathrooms and other markers of quality, and to make sure that the housing is deeply affordable, tenants are rent stabilized and protected, and pay no more than 30% of their rent. The Department of Social Services has a thing called the Master Lease Contract that helps provide financing and also service dollars and money for
the New York City Department of Social Services.
Yeah, the New York City Department of Social Services. It's a promising new tool, but it's untested. It hasn't been used. There's a number of people trying to figure out how to make it work. There's also federal capital for affordable housing. The American Rescue Plan Act is the COVID relief bill that was passed a couple months ago. That provided $5 billion for homeless housing nationwide. 273 million of that is going to come to New York City, and 94 million will go to New York State. So that's money that can be used for a variety of purposes related to homelessness and permanent housing, and hotel to housing conversions would be one of those. The American Jobs Act, which is the infrastructure bill that's being debated now in Washington, right now it has $213 billion nationwide for affordable housing. I have seen affordable housing drop out of infrastructure bills too many times to predict what's going to happen. But that's a huge infusion for affordable housing, not just homeless, but all types of affordable housing that would be really welcome in New York City and might be able to be used for these purposes. Other states have responded to COVID with hotel conversion initiatives. California's Project Room Key moved a lot of people into hotel rooms as shelter, the same as New York City did. But then they followed it up with something called Project Home Key that provided more than $800 million across the state of California that allowed nonprofits to buy 94 hotels with 6,000. They're going to have 6,000 housing units eventually. But it's going to take them a couple years to convert these things. But they're already working on it, and the governor has proposed billions more for this purpose. And so seeing the $100 million in the bill, in the Honda bill, it's just a start. But it is something that we can do. Hopefully, we'll be able to start buying hotels before there aren't any hotels to buy. But it's really hard to tell what's going to happen because the city is starting to open up again, and hopefully we'll get back to normal.
Ted, can I ask you two questions to start the discussion off?
Yeah, I think that this is better as a discussion, but that's what's going on right now, and there's a lot of issues to be decided and to be figured out. I mean, and we need to be careful in how we go about doing this because it's no longer a COVID pandemic emergency, and so let's be measured and thoughtful about how we go about converting hotels to permanent housing and do it right. Before you start, Joe, I mean, I think a useful precedent is in the 70s and 80s, we saw a lot of hotels turn informally into permanent housing. People just started living in hotel rooms. And then when the good times came back and tourism came back and J51 encouraged building owners to rehab their buildings, a lot of people lost their housing, and that's why we have so much homelessness. It's not just deinstitutionalization, it's also the places people move to disappeared as well. And we want to make sure that any hotels that get turned into housing now stay housing and tenants stay protected. So there's a lot to figure out, and I think that having the community involved is really, really important in this initiative.
Which is a perfect segue to my first question. We sent to you the community board's position on criteria and selection, how to manage support, for how this process of conversion can happen. Could you just give the committee some of your response on some of the items in there so we can hear from you?
I completely, I looked it over last week, looking at my notes here. I mean, I appreciate that you make the distinction between affordable and supportive housing and shelters, and focusing on a permanent affordable housing plan, and using the opportunity for that is really important. I think that, I think that there are management issues with nonprofits that is much larger than just this issue. And we were hearing about that in the previous presentation and the questions there. I think it's really important to address that, but I think that's a much larger issue. And I appreciate that you guys were pushing for no offsite fund to create housing somewhere, affordable housing somewhere else. And some of the other things you said, I think that smaller is better, more manageable, making sure that there is adequate services for people who need them to stay stably housed is really important. I think a unit mix and an income mix is ideal. I think that pretty much everything that you say is thoughtful and makes complete sense. I think that when you come up against the realities of housing development, sometimes there are trade-offs, because it's not always possible to have a wide mix of incomes in one building. It's not always possible to have, sometimes buildings are bigger and they can still be successful. Sometimes buildings are too small to make them work financially, and it can be just as bad to have a 30-unit building that is underfunded and has, bad conditions and everything, as it can be to have a very large building that is not well managed. Although I think that, our primary attention will always go to the larger building, as it should, to make sure that that's running well. So I pretty much agree with what you guys had to say, and I appreciated the thoughtfulness of the document. The map was interesting and really helpful. I think Midtown has always been a place for SRO housing. And, having lived in the city for, almost 40 years, I think that, we got to make sure that there's a place for everybody to live. And it's not always possible to have studio apartments in Queens and things like that. That said, Midtown shouldn't be asked to bear an outsized share of all homeless housing. I think certainly it's it needs to be, what I would like to see is to see all these hotel shelters shut down and replaced with affordable housing at different income levels. We'll see what happens in the next year or two. But
so the last question before we get to the committee is, given the current funds at the state, how many projects citywide do you think would actually happen? Because I think there's a big fear in our community that every single building is going to get converted to some sort of supportive housing.
Yeah,
that's a. Can you help frame that for us, and then we'll start peppering you with questions.
Yeah, that's not. It won't happen. I mean, $100 million at $350,000 a unit. We're talking less than 300 units. Statewide. So I know that, the hope is that additional money will be put into the Honda fund, as part of the state budget, and then perhaps some federal money as well. And what I would hope to see is that this money would leverage other funding streams so that it can create many more units than that, because I think there are thousands of units that can be created of permanent, affordable, and supportive housing. The fact is that while Midtown has a lot of the hotels, it doesn't have all the hotels, and I think that the hotels that are going to be less, any hotel that is viable as a tourist hotel is going to stay a tourist hotel. Any hotel that is viable for conversion to market rate housing will be converted to market rate housing before it becomes affordable housing. The prices have to be really low. The hotel needs to be in real distress for it to be affordable to affordable housing developers. In terms of the number, I wish that we could build, 30,000 units of affordable housing tomorrow so that we can make a real dent in the 60,000 people that sleep in shelters each night, but it's just not going to happen that way. It just takes too long to build affordable housing. And, I'm hoping for a couple of thousand units statewide. And if that's the case, you might see, if we're lucky, a couple hundred units across Manhattan, but it remains to be seen.
JD, you had your hand up.
Yeah, Ted, thank you so much for that very thoughtful presentation. I want to ask a question philosophically. Hell's Kitchen Special District has a mandate to have a range of incomes. This community board has always said, yeah, we need low-income housing, we need supportive housing, we need homeless housing, we also need moderate middle income housing. Now, that's always made sense to me, and that's been our mandate. And it makes sense to me because you want a balance of incomes, I think, to make a viable community. As we've seen tonight, when the city really doesn't care so much about this, they want to solve a problem and check a box. What are your thoughts about the mix of incomes to make a viable, functioning community? I know that's a philosophical question, but when you say affordable, do you think about that? Is that part of the mix?
Yeah. I mean, I started out as a homeless advocate, but I quickly realized that, permanent housing was the answer to homelessness. And so I learned about affordable housing finance and what it takes to actually create permanent housing. And someday I'll know as much as Joe Restuccia, but we'll see. But I think I was the chair of Housing First, which was an affordable housing campaign that got Mayor Bloomberg and then Mayor de Blasio to commit to large affordable housing initiatives. And we always pushed very hard that there needed to be a mix of incomes, that the housing reach not just homeless, not just low income, but also middle income, the firefighters and nurses and teachers and everybody else that should live in the community. I think that those housing plans, those affordable housing plans did exactly that. But at the same time, now there is a realization among many advocates that, while Mayor de Blasio may be presiding over the very largest affordable housing development initiative ever, it's still only creating a couple thousand units a year of permanent housing for homeless individuals and families. And we need to do more than that. And I think that we're also seeing that a lot of housing that is built for people at 120, 130% area median income is very difficult to rent up. They're having a very hard time finding people that will go through the paperwork to rent this. They have to prove their incomes. And the fact is that the rents are just a tiny bit lower than market rate in a lot of neighborhoods. And so, the best intentions are that, sometimes you get unforeseen consequences. I think that no matter
I would say, Ted, in many neighborhoods, not in our neighborhood.
Not in your neighborhood. I think that's probably right.
Yes.
The area median incomes are calculated over the entire metropolitan area, so that if you build 60% AMI in the Bronx, it would be twice as much as most people in the Bronx earn, which is, so that's low income housing, and yet it's going into the Bronx and gentrifying the Bronx. Whereas if you built 60% AMI housing in Hell's Kitchen, that would be very deeply affordable housing. And so it's a tricky kind of thing that they try to make a balance of. I think that, from my perspective, homelessness is an emergency and we need to treat it as the emergency it is. But I don't want to see anything happen like what we've seen on 36th Street. I do not think that we should allow anything like that to happen to any neighborhood. And, it's all about development opportunities. There are fewer and fewer development opportunities in Manhattan because the land costs have gotten so high.
Dolores, question?
Actually, Ted, thank you very much. I had the pleasure of seeing your more in-depth presentation earlier this week. What I wanted to say is that I'm very happy that you explained how much those dollars would actually go and the actual number of units or housing spaces that 100 million would create. Because I think it's real important for all of us to understand this is not about converting an entire
district
fleet of stock. But also, I think what's real important and very very concerning for this community is because we do know that the range of incomes, as JD was saying, does work. Joe Restuccia actually produces exactly that, where you have mixed incomes and you have supportive services, and it works. So what we're concerned about is this overall advocacy, which could very much end up being more towards the very single-minded homeless advocates that aren't understanding the nuances of particular communities and neighborhoods. And I don't know how to solve for that, but I do want to open it up to thinking about how to be mindful as we move forward, to be supportive of this concept of creating a framework of what could be a more permanent solution for the many that can't use their vouchers and that can't find a place to go. So I appreciate that it's a broad idea, but we do have specific concerns in this community, which, as you heard earlier in the call, best intentions, not so great when we actually put it in practice.
Yeah. Well, I mean, I appreciate that. And I think that what we will see is that no matter who becomes mayor, that the next affordable housing development initiative is going to be more skewed to lower incomes. I mean, the fact is that Mayor de Blasio's affordable housing initiative creates a larger percentage of deeply affordable units than Bloomberg's did, and before it, the Koch plan, which was continued by Mayors Dinkins and Giuliani. So we have been going steadily towards skewing to deeper affordability, and I think that that will continue no matter who becomes mayor. I think that you can create deeply affordable buildings that can be good neighbors, but and I think services on site really help that. But you can also create really healthy neighborhoods, even if some buildings are, all skewed to 60% AMI or less. You would still be able to have them as good neighbors. But I think that, having a community board with a plan and a vision, as you guys do, makes a lot of sense and really helps the conversation and helps to keep track of what's actually going on in a neighborhood. Because the fact is that city planners, they appreciate information, they appreciate data, and they'll respond to it. It's sometimes actually, it strengthens the anecdotal stories, and the fact that you did that. I saw one thing that I saw in the plan was asking for a 50% community preference, which makes sense because you have so many people in the neighborhood who are just hanging on. I live in Brooklyn because I lived in Manhattan for 11 years, but I couldn't afford it anymore. And I know a lot of people are struggling, so it makes sense to ask for that. But community preferences are under attack, and there are a lot of fair housing rules that come up against that, and so that will be an uphill battle to ensure that people in the neighborhood are able to get access to it. I don't know what the answer is to judge between all these different concerns, but that is just one thing I noticed about your plan.
Just a note for committee members, I'm going to go around the room. Anybody has any further questions? We have another item. Betty, any thoughts? Leslie? Betty, yes? You're on mute, Betty.
I know, I just had to get to the little symbol. Thank you very much, Ted, for your presentation. And I was wondering, given that you are so experienced in the housing field, and you heard, I guess, our first agenda item, do you have any advice for Community Board 4 with our terrible dilemma that we have to get the attention of the mayor to make progress with this dire situation?
I think you're doing what you can, and I know that Yvonne and Leilani are going to bring this back. I mean, I think that you made a very good presentation today. You know, as a collective, it was really compelling to me. And you know, when I first heard about the COVID hotel shelters and people complaining about it, I went and visited the Upper West Side, and I visited the West Side. These are neighborhoods that I lived and worked in. I used to, you know, have an office on 37th Street, and before that, I worked on 8th Avenue and 35th. You know, the Upper West Side looked like the same old Upper West Side to me, but there was a noticeable impact on 36th Street when I went down there. And this was last year, but from what I'm hearing, you know, it sounds like it's still a very serious problem. I mean, you just gotta raise your voice and just keep at it. I think that this administration is losing energy as the clock ticks down, and that's unfortunate because there's a lot of issues to take care of. We would have all been better off if we had a new mayor on January 1st, not as a criticism of the present mayor, but just because administrations tend to have a lot more energy and a lot more political capital in their first year than they do in their last. But I think you got to keep on pushing you know, your issues and to make sure that people see what's going on. I think that Joe and Maria have done a very good job of making a reasonable, you know, the reasonable person case that this is not acceptable without it being a NIMBY case, because the fact is that the West Side of Manhattan has accepted a large number of supportive housing units over the years. You have a significant shelter population without the hotel shelters. And, you know, what I'm hearing from you sounds reasonable, and really the city should be responding. But, you know, all you can do is raise your voice, I think.
From your mouth to God's ears. Josephine, Jessica, any thoughts or questions?
No.
Leslie? Paul Ames,
yeah,
Pete Diaz.
I just had a quick, sorry. I just had a quick question to ask. Because you know the city, Ted, you've been around for a number of years in the field. What's your sense as to the current crop of people running for the mayor? In that group, who do you think would support us most?
I think that's not a fair question to ask for someone coming in.
Generally.
But Leslie, good try.
I would say this. I'm not going to answer that question.
Okay.
I would say
I
would say that, you know, that any candidate, any elected official is a prisoner of the zeitgeist. You know, that there is only so much you can do in any one direction usually, unless there is a groundswell of public support to do something. And even when there's a groundswell, it can be very difficult to move outside the margins of incremental change. I think that, you know, from what I'm seeing in the mayor's debates and in conversations with the various campaigns, there is a real commitment to affordable housing. And I think that matches the conversation that's going on nationwide. We have our housing, our system for producing housing, not just affordable housing that's subsidized directly from the government, but any kind of housing is broken in this country. We are not producing enough housing to meet the needs of 330 million people. And so I think we're going to see more affordable housing investment. I'd like to see that accompanied with a streamlining of the processes it takes to build housing so that we have more market rate housing built and it becomes less expensive to build housing so that the housing that is produced is less expensive. Whenever you see affordable housing money, there was a question about how much does 100 million buy? I mean, a general rule of thumb right now is that a studio apartment, an affordable housing studio apartment costs about $500,000 to build in New York City. That's a lot more expensive than anywhere else in the country except San Francisco. And that's because we have a very densely built old environment, and a lot of those affordable apartments are being built from buildings that are being preserved and repurposed and everything like that. And that makes it more expensive than ground up construction. But I think that any mayor that comes in is going to be doing more on affordable housing. I just hope that they're more intentional and thoughtful about how to respond to homelessness, you know, given the constraints of the right to shelter and all the other things that drive our homeless problem.
I just want to know for the committee members, we're now at 9:10. We have one more item, which is an inclusionary housing plan. So God bless those developers. I want to give the last word to Maria. Any thoughts on this?
No, I don't want to keep us longer.
Okay.
I'm trying to do this meeting and parent over here, and it's a
Yeah, I know. Okay. Well, thank you very much for having me. And I don't know, Joe, feel free to share my email if anybody wants to reach out.
Yes.
It's my name is Ted Houghton, and my email is thoughton@gatewayhousing.nyc. That's thoughton@gatewayhousing.nyc.
We'll have Nellie put in the chat. Thank you so much.
Great. Okay.
But before we let Ted leave,
Yes,
you know, I know that we haven't fully flushed everything out, but I do think it's important that we've discussed here, and that also Ted has opined on our own plan. And I do think it may be appropriate to make a motion to say that we have considered that there is this opportunity and possibility, not to advocate specifically for one or the other, but at least to acknowledge that we had this presentation and conversation. So didn't know what the committee's thoughts were on that.
I think considering that we're dealing with some major presentations tonight, that's a very simple thing to write to Ted saying, and thank you for coming and giving us your responses, and sort of like, you know, like listing a little bit of it, because I think we have a lot of common ground. This is very good.
All right. Well, thank you for having me. Really, it's a pleasure, and it was an education to see the previous presentation. Thank you.
Thank you.
So your burrito.
Yeah.
All in favor of that very simple thank you letter? Raise your hand. All opposed? Any abstentions? Okay, carries. Now let's go to our next presentation, and we want to
thank you, everyone.
Thank you. We want to go to Conic. This is the follow-up, the inclusionary housing plan for 312 West 43rd Street that the Clinton Health Kitchen Land Use Committee saw on the zoning issue. And now we have, and by the way, thank you again, Penny, for you get the survival mode today. Okay, we really appreciate it.
No, you guys get all you've done the hard work. It's been really an interesting discussion.
And we have Sarah Smith. Who else from your team, or just the two of you?
We have Ken Lowenstein as well.
Ken Lowenstein, yeah.
Yes, great. Okay. So will I be sharing the presentation?
Yes.
Oh, I am. Oh gosh. Okay.
Yes. No, it's because we had some issues with the back and forth with Jesse and the Dropbox, so not everybody has seen it fully.
It's okay. Not a problem. I got it. Give me 1 second.
Nellie, can you give her permission to do that?
Joe, and where are our speakers from?
Yes, this is. Oh, yes. Can you identify yourselves, who you represent?
I can identify. Sure. My name is Penny Knops. I'm the development team lead with Taconic Partners for this for the 312 West 43rd Street project. I have Sarah Smith from Handel Architects.
Yeah, sorry, I must unmute. I'm Sarah from Handel.
And Ken Lowenstein's with us as well.
Ken Lowenstein is an attorney. He's appeared in front of this committee about 42,000 times so far. So.
Good evening.
Great. All right. Okay.
Able to share, Sarah? Penny?
I am. I apologize. I would have been. Okay. Here I go. All right.
So the first thing, just quickly give us orientation, where we are, what's happening.
Exactly.
Members who are not at the land use committee.
Correct. So I will try to be brief and respectful of all of your time. I'll do a quick overview. Sarah will walk you through the building really quickly, and then I'll jump back in. This project is located on 43rd Street, near 8th Avenue, between 8th and 9th. Sarah will walk you through some of the details of how it's sited. But as many of you may know, we are in the process of a special permit application. So this is currently with city planning. So we're pleased to come before you and present the inclusionary housing plan to the committee. The development is a mixed-use building. It's primarily residential. We're proposing 330 total rental units, along with some retail programming planned for the ground and the cellar floors. Of the 330 units, 15 are voluntary inclusionary housing and applicable under the R10 program. As far as the project schedule goes, we are actually currently in process of demolishing an existing building on site, which is the former headquarters of the 1199 SEIU. Project is actually, they own the land. This is a ground lease through the 1199. So they're almost our
And let me interrupt you
partners.
1 second.
Yep.
So people don't get confused. 15 under the voluntary inclusionary housing, but there's more affordable units. Can you just mention what those are?
Sure, under Affordable New York. So there's a total of 83. Right. Yes. So 15 are under voluntary inclusionary and 68 are part of that, for a total of that 83 units. We have commenced demolition in November, interior demolition. We will be beginning structural demolition within the next 2 to 3 weeks, and that should take us through the summer. We're targeting September for completion of demolition, at which time we want to roll in to our transition to our site work and foundations. But after that brief overview, I'll hand it to Sarah. Sarah can just walk us through, the project as a whole and the design of that.
And I need to break you one more time, so everybody understands. Please explain Affordable New York versus VAH.
So I can jump in and do that.
Yeah, Ken,
Okay.
Go ahead. Yeah, Ken.
So affordable voluntary inclusionary is a program under the zoning resolution where you get a bonus for providing affordable housing. All the affordable housing under Inclusion New York has to be under 80% of AMI. Only a portion, as you will hear, only a portion of the site is actually in a district that we can use VIA, voluntary inclusionary for. But so we have 15 inclusionary units. In addition, there's total of 83 affordable units under Affordable New York. 10% of the units in the building, 33 will be, and this is mandated by Affordable New York, will be at 40% AMI or less. 10% will be at 60%, and then 5% will be at 120% or less. So it's a combination of the two programs. As a technical matter, only inclusionary, the application before you only relates to the inclusionary because that's required by the zoning resolution. So that's why all you see is the actual information on the inclusionary housing units.
So I wanted to make sure people were not confused because it's two programs in the same building. And the difference is the voluntary inclusionary is permanently affordable. And Ken, what is the affordability term on the Affordable New York?
40 years. And then it's the tenants in place can stay, it stays affordable as long as the tenants stay in their unit after the 40 years.
Right. And then upon vacancy, it reverts to market, right?
Upon vacancy after the 40 years, that's correct.
Yes.
Is that 421A, Joe, just for clarification?
Yes, it's 421A or Affordable New York. This is saying it's the new, it's what we call new 421A or Affordable New York. Right.
Right. It's the new version, Maria, really. Yeah.
Right.
Okay, sorry. Take it away, Sarah. I just want to get that clear.
Great, no problem. Thanks, Joe. Yeah.
All right, Penny, can you go to the next slide?
Sure. Yes. All right.
All right, so as Penny said, this project is located on a 3-block site between 42nd Street and 43rd Street at 8th Ave. There will be a 7-story building on the 43rd Street frontage, as well as the residential entrance that is used by all tenants. The lobby will connect from 43rd Street through the site to the 42nd Street portion of the building, which is a taller 32-story tower across the street from the Port Authority. Go to next. This elevation shows the 43rd Street frontage with the proposed 7-story building in the foreground and the 32-story tower in the background. So the 7-story building is the portion of the site that Penny mentioned we are applying for the ULEP for increased height. And And the building will contain 330 units, and it has residential amenities on the second floor and the 31st floor of the tower portion of the site. And it will have retail spaces on the ground level and the cellar. The next. So this image shows the street level of the 43rd Street building and the residential entrance as you walk towards the building from 8th Ave. The vertical louvered wall to the left of the entrance allows nice visual access into and out of the lobby as you walk by or enter the building. And then further down the block are the ground floor retail storefronts. Go next. So this is our ground floor plan. At the top of the sheet, you will see the residential entrance at 43rd Street that we were just looking at. As soon as you enter the lobby, you are greeted by the concierge and the nearby mail and package rooms. And then the elevators to the 43rd Street portion of the site are immediately to your right when you enter, to the left on this drawing. And the tenants who live in the 42nd Street portion of the building will travel through the lobby to the elevator core on the south side of the lobby. The stair you see in the center of the lobby near the south elevator, the one labeled Stair to Garden, will provide access for all tenants to the common courtyard on level 2. And then there's other, on the ground floor, there's also these retail spaces dispersed throughout on 42nd and 43rd Street.
Correct. And
Penny, do you want to jump?
No, I think that outlines sort of how Joe, there have been questions on how does this work as one building. It is very much one building. There are two components, but it's the one.
Yeah, it is one building with 2 wings and 1 entry, 1 lobby. Period.
Exactly. Yeah, you got it. So, thanks, Sarah. This slide just really demonstrates how, while we're still finalizing the interior design of the project, we've outlined a list of proposed kitchen appliances and interior finishes for both the inclusionary housing and the market rate units. I'll say our goal is to really maintain equivalent design intent and integrity across all of the units. There's no perceived changes in quality or standards, whatsoever. So, for example, the appliances we're proposing are by the same manufacturer. We're looking at Bosch. We're proposing an inclusionary. They would have a different finish. They would be stainless steel in those units, and panelized in some of the more market rate units.
Could you explain panelized for the committee, please?
So panelized is when it looks like a cabinet and not a stainless steel. So it looked like
it makes it disappear into the whole kitchen.
Correct. And while we haven't finalized the exact specification, of all of our interiors, we do know we will be using an engineered wood floor across the units. There's no vinyl tile in it, affordable. It's nothing like that. We are really looking for equivalency across these, if not identical. So it's demonstrated on this list, and you will have this list as I understand it. And a quick note on the amenities, Sarah touched on them. Up at the second floor, we have a landscape courtyard, and this is kind of that community connection that really brings those two, the 2 wings of the building together and in a common space. It's almost just over 10,000 square feet. So it'll be landscaped with some outdoor recreation, a lot of seating and some shaded and plenty of plantings. Also on the second floor, we will have some of your standard suite of amenities. We'll have a lounge, private workspaces for those working from home, a fitness center, gym, a spa, which will have your sauna, your steam room programming. And up at the top of the 42nd Street portion, we're going to have another outdoor terrace area, lounge, small private dining room, and we're really hoping to incorporate a pool if all the stars align. And if we get it off, we're looking to incorporate a small outdoor pool up there as something fun for the residents. And just to note that while we have not included the interior amenity floor area in our inclusionary calculation, they will be accessible to everyone. They'll be offered at a discount. There will be a fee for a market rate and a discount for all the inclusionary housing residents. But all the outdoor amenities, both at the second floor, throughout the garden, and the 31st floor roof terrace, they will all be open and accessible, of course, no charge. So with that,
we should just note that that's sometimes not the case, so thank you.
Okay.
And you also did not note that you have washer dryers in all units.
We have washer dryers in all units.
Yeah.
Correct.
Right.
Yes. I can pull up that slide. Yep. Equivalent, the same equivalent.
Okay.
And that's our brief presentation. We're happy to answer anything.
You need to, we haven't seen the stacking plan or any plans.
All right.
You have, I don't know if we put the stacking plans on the slide. I don't think we did, but.
We didn't,
right.
But guess
But you
what?
have,
I'm sitting
I
at
guess
my
we
computer.
sent them
so.
to you.
No, I know, Ken. We had a little issue with this, and all the committee members got it. So
Okay.
Sarah, maybe
Oh,
you
really?
have them.
Yeah. Do you have it, Sarah? Do you have the latest handy?
There was a technology thing, Ken, that got worked out very late.
Okay.
Yeah.
Okay.
Here.
Well, in the meantime, go to Dolores' question.
It's attached to the affidavit, Sarah.
Dolores, you have a question?
Yeah.
So I just wanted, if while you're working on that.
Yes. Please.
Hi. While you're working on that, I just wanted to see if you could make a comment on some of those changes that you made to the design on the 43rd Street side following our previous meeting. It looks like you have made some changes. And I'd like to just say for the record that the visual that I just got a chance to see, I like it even better. And I think that this is a very handsome looking building, and congratulations on figuring out how to make it one building.
Thank you. I can touch on that quickly. It's certainly, in keeping with some of the conversations you've been having today. We removed this, this entry. Are you responding to that? Yeah.
Yes.
So we removed all the planters, all the planting. You can't see in this one, but we've now included uplights from below. So, not to blind anybody, but to lighten the space, brighten it up, and make it very visible. So from the inside, you will clearly, you can clearly see out. The concierge is located right adjacent to that window. There is a door here, so there will be, there can be activity in and out coming through this. So we've brightened it, we've lightened it up, we've cleaned it out, and we're happy with it, and we appreciate your comments.
So on the amenity
Sarah,
side and the amenity side and the finishes, you seem to have met the normal requirements and requests that the committee would make and the board would make. We just need now to see the stacking plan and distribution to understand where the units are.
Right. So
yeah, Penny, I can share my screen actually.
Great. I have an
So you
old
have to
school
unshare.
printout of it, if that helps. But,
Penny, if you can unshare, and now Sarah, if you could share.
I did. Yeah.
Sure. Yeah. Okay.
And one day we'll just be sitting in a room and talking.
I'll have the same piece of paper.
All right, so we have the two portions of the building we talked about. So this is the vertical distribution for the 42nd Street portion of the building. So you see there's units here from levels 4 through 12, and then there's another one level 19. And then we have 5 additional units in the 43rd Street portion of the site, one on level 2, 3, and then 4, 5, and 6. So that's how there's just one on each floor. It's only there's 15 units spread throughout. And then for the horizontal distribution, same thing I just said. It's only one on each floor.
Yeah, we don't come close to the 33% limit, obviously.
Correct.
So for the bedroom, I'm sorry.
Yeah, just a quick question before we get to the size distribution. Ken, how does this connect, or how does this play with the affordable New York units and their distribution?
What do you mean? What do you mean? How? Is it, well, we have a separate.
How do we?
I'm sure you. What do you mean by that?
I understand. What I mean is, to see the full picture, we know we're considering the VIH, but we want to understand the other affordable units under affordable New York. Where, on what floors are they? What locations are they?
Right. We'll send you a separate, we'll send that chart separately, Joe. We just focused this on the IH, but we can send you that chart.
Yeah, I mean, yeah, I know why you're here, but we're responding to a project.
I hear you. No, it's fine. We obviously have done that, and now we have that information, and we will send that to you.
Yeah,
we can say they do go through the 23rd floor, so 76% of the floors.
Yeah, it's like
that is one thing. So.
Right, the numbers of floors and sort of how they lay out. So that's good. If you can go now to the breakdown by bedroom count, by unit size.
Again, it's only for the we give this to you for the IH.
Sure,
We'll send it to you for the affordable for the combined.
Right.
For the inclusionary housing, there are 2 studios, 10 one-bedrooms, and 3 two-bedrooms. The breakdown there's so few units compared to the number of units in the building, so the percent breakdown does vary quite a bit, but that's just a result of the number of units. We did add an extra 2-bedroom.
Right.
Right. That was my question.
We had an extra 2. Right.
Right. And so again, in terms of this with the Affordable New York, are there also lots of 2 bedrooms on that side of the equation too?
Yeah, it meets we meet the proportionality requirements for affordable.
Right, that's what I'm asking.
Yes, yes.
Okay. And this building has no 3 bedrooms?
No, there are no 3 bedrooms.
Okay, good. So it's really studios, 1s and 2s. All
right. So it's a straight. It meets all the proportionality requirements, but we'll send you the specifics.
Yeah, and what we'll do is Nellie, to make sure we send that out to all the committee members, so when we write this thing up, they can understand the 2 components of it. Because Ken, we'll just opine on it, not in terms of approving or disapproving. We're going to just sort of note how it works together, you know.
Fine. We'll send that to Nellie and the board, and you'll distribute it.
Yeah. Yes. Okay. Yes.
They'll distribute.
Yes.
Fine.
Yeah. Could you go back for a moment? Is there anything else on this, Sarah, that is helpful for us?
Those are just the unit sizes, you know.
I think that covers I think that covers the usual items.
The usual stuff.
Yeah.
Okay. Yeah. Right. So can we return to the amenities for a second? We normally talk about Penny. What is the percentage of a discount or affordability for the any sort of thing you have to join? So can you talk to us about that a bit?
Yeah, I don't have that yet. We don't have the pricing for the amenities. We haven't.
Oh no, I didn't mean the
that,
pricing.
The amount of the reduction.
Yes, the percentage discount. Right.
Yeah. So that I'll have to get back to you. I'll circle back with Taconic management and operations.
You know, again, we normally include that saying that it will be roughly X%. Sure. So again, there's an expectation and understanding all the way through.
Okay.
And what do you like to see?
Let me circle back with the management team. Yeah.
What do you like to see, Joe? At this point, just a general guideline.
I think we should probably we have a whole number of things we've done, Ken. I'll just have Nellie, you there?
Yes, Joe.
Could you just send to Ken maybe like the last 4 inclusionary letters we did, so we can see how it worked exactly? I don't have it in my head, Ken. I'm sorry.
Okay, that's fine.
Okay,
right.
Not a problem.
Good. That'll give you a good guideline.
Yes, you forgot something, Joe.
Please tell me, Ken.
I know the feeling. Trust me.
No, I am in a COVID moment. Go ahead, Ken.
No, go ahead. You go. I'm sorry.
No, please speak.
No, we're done. No, we'll send us that information, and Penny will follow up.
I forgot something. What,
no, you forgot the percent. You forgot the percentages. That's what I was referring to.
Oh, and yes, I forget. Yes, I have had it. I have been managing a very serious Clinton housing emergency for the past 5 days, so I'm a bit
sorry.
I'm sorry.
Sorry.
I apologize.
No, don't apologize. I was trying to make a joke. I'm sorry.
All right, if we can unshare the screen and let's have some committee discussion. Okay, so everyone, there are members of the committee who have not done inclusionary housing before. It's a little more coherent. Let's go to JD first. Questions?
Yeah, a great project. Congratulations, everybody. Ken, I didn't understand the distribution, the proportionality. Could you explain that? The distribution of the apartments?
Sure. So both programs require that the bedroom mix of the affordable units be proportionate to the bedroom mix of the market rate units. There's another test which doesn't apply here. So that essentially, if you have, if 20% of the if the studios, 20% of the 20% of the
Total.
affordable units are studios, 20% of the market rate is studios, et cetera. You cannot skew, the idea being you cannot skew the affordable to smaller units and keep all the larger units for the market rate. So you have to have the same
Market and affordable
across the board.
They must be a mirror of each other.
Gotcha. And they're distributed equally throughout the building. There's no.
Yeah, as you show on the
up
chart,
to-
I mean, we have one unit. We'll show you the chart on Affordable New York, but they're 80, but they are distributed. This Affordable New York, the inclusionary limits the amount of inclusionary units to 33% on any one floor. Affordable New York has a 70% maximum. So the programs have different requirements on distribution.
And voluntary
Thanks,
inclusionary housing is up to 65% of the floors. They're, and we usually negotiate for more. I think in this tower, there's a kind of a mix that kind of works.
Right, and we wanted to we put them in both towers, as you can see. So we didn't just say put them all in one tower. I mean, so we need, and once you do that, you don't have, we only had 10 units, so you can't put them on all the floors. We distributed them, as you saw, up to 19.
Thank you.
Are we
And
going to
I
be
wanted
able to see a document?
I want you to just know for the committee, the unique circumstance here is the site is split between two underlying zones and two parts of our Clinton Special District. So there's not a lot that sits in Clinton Special. Sorry, it's in the perimeter area, and therefore we're not seeing that normal mix that we would see if it was entirely in the perimeter area. That's a key issue here, right?
Right. Yeah. No, exactly right.
Yeah. Yes, Maria. Sorry. Go ahead.
I was just going to ask, I think you mentioned it before. I guess it's related to what JD was also asking about the distribution of the units. Are we going to be able to see that? Is that one of the documents that you are sending over? I guess the distribution and where the units are, where the windows would face for the units.
Oh, yes. We haven't seen a plan that is normally presented with the color coding of here's the affordable, here's the market. We reason this comes up, Penny, we just had an issue with a development on 23rd Street where the development, and we're still working through this. Every affordable unit seemed to face a courtyard that would have a building next to it eventually, as opposed to being distributed fully throughout the building. So that's why
we can put that together very quickly. Yeah.
And it might be helpful too if you could, just give us one document that says here's Affordable New York, here's Voluntary. See how all the things interplay, because it's hard for people to consume.
So you want two separate documents? Fair enough.
I'm not, right. I'm confused. What you want? You want one document where we put both in? We show all affordable units, and do you want us to differentiate in that document between the Affordable New York and IH? Or okay, fine.
Please use two colors, so it's really easy for people to get.
Fine. I got
it.
Marker ring white, two color, one color.
Got it.
All right.
Fine.
Yeah,
that's clear.
Other questions from committee members? Those of us who have made it to this hour. Martin Street, yes.
Hi again. I'll be watching from my terrace on the 33rd floor, and I'll be mindful of the noise you make in construction.
So Martin is speaking. He's in Manhattan Plaza, 9th Avenue and 42nd Street, and concerned about construction noise going forward, even on the 33rd floor. Penny, can you speak to that?
Sure. It's a valid concern. It's construction, in New York, and we're looking into trying to forecast, where the problem spots be, and what are the ways to, to help mitigate that in respect of all our neighbors. We are currently having those discussions. So.
A normal day.
8 to 6 and normal hours construction.
No weekends.
And Martin, remember, we have a building right across the street from Clinton Housing. It's only 7 stories. It's going to be very loud there too. We get it.
One more.
Go ahead.
I'm a resident of 30 years. Any chance for an alley between 42nd and 43rd?
Martin, we already talked about that. Yeah, we had talked about that at the land use committee, and the board did not support it at that time because of the very weird constraint of this site.
Thank you.
But thank you for asking again. Other members of the committee? Yes, Betty, go ahead.
I think maybe somewhere I've missed one of the presentations on this, but for the Affordable New York affordable units, I'm very used to the housing committee having an application that goes to HPD, and then there's a certain protocol from HPD. Are these Affordable New York affordable units not part of that process?
So under the old 421A program, the community board received a copy of the 421A application, as you just said. That is not the case under the new 421A or Affordable New York program. There's no requirement that the community board receive a copy of the application. So that process is not used anymore by HPD.
Right, and as the program changes again, it's up for being discussed again. Betty, we should probably opine on that because that's a good way that we kept aware of what's going on. You understand that 421A is currently reconsidered again in the legislature right now.
And it's next year, more like it's going to be considered next year.
I know, but I'm saying being considered in terms of another reform in general.
Correct.
Right.
Correct.
Okay, thanks. It's kind of confusing, but thanks.
I understand.
And he's the attorney. He's confused too. So, other members of the committee, let's go around. Questions, Josephine.
Quickly, are there any, is priority going to be given for seniors that's formerly homeless or current residents in District 3 under either Affordable New York or the other program?
District 4.
District 4, sorry.
Ken, there's a 50% community preference for lottery, correct?
Not for Affordable New York, there's not.
No, for inclusionary.
No.
Yes. What are you talking about?
I don't think there's I don't believe there's. Let's just take this one step at a time. We were the units will be marketed through the HPD lottery and marketing process.
Right.
And they don't. We can't designate units for seniors in that process. I'm just. You asked that question. Sure. In terms of the community board, yes. I believe, Joe, that there's no community preference for IH or Affordable New York anymore. But you may do these. You probably have more direct knowledge of marketing than I do, so I will defer to you on this.
Well, just to note that having been involved in a deal with Taconic, there is a community preference for inclusionary, and the community board sees them all the time. We see these plans.
There certainly was on the 52nd Street.
Right, but that was because of 421A.
Yeah.
No,
that was because the old 421A.
It was inclusionary.
Inclusion. I will double check. It's my understanding, and again, I may be wrong, is that the old inclusionary projects, which had 421A, the reason they were subject to there was a community preference, was not because of inclusionary, because there's nothing in inclusionary statute that has a community preference. But there was a provision in the 421A law, the old 421A law, that had allowed community preference, that provided for community preference. Buildings under the new program, there is no community preference. I believe that is my understanding. We will confirm that and let you know.
Right, that's under 421A. It is my understanding that under
I hear you.
mandatory or voluntary. So Penny, this is something we need to know, because I would say we'd vote against it if it's not there.
It's an
honestly.
HPD. We'll find out what HPD's rules are. It's not. We don't set those rules. We don't make those rules.
But every single inclusionary development, irrespective of 421A, offsite, sideways, upsize, and downsize in the past 15 years, has had a 50% community preference.
Again, Joe, if we will check, let's check. Let me check. Let's find out. Let me ask, see what HPD says. Whatever the rules are, we're going to follow. It's not our call.
But I want to note that if there, for whatever reason, there's not a community preference, I think you need to voluntarily work with HPD to establish it.
Okay. I mean, HPD, I think there's a lawsuit on this whole issue.
I am
and a fair housing issue. And
no, it's a zealous advocate issue who believes that the world is not made up of communities, but just of certain segments of our city.
Yeah, I'm not taking a position, so I'm just reporting it. But okay,
you will get back to us on it. Yes.
Yeah, of course.
Yeah. Anything else, Penny?
No, I have my list.
Penny?
I'm ready.
Okay.
I have homework.
Okay.
It's 10 o'clock. I got work to do.
Committee members, Leslie, any questions?
No questions.
Jessica?
Sorry, no, I'm good.
Pete Diaz?
Clarification on the cabinets. You mentioned something about stainless steel versus some other finishing. Can you please clarify?
That was appliances. That was kitchen appliances.
And are they all the same on the inclusionary housing unit, as well as the
let me take that for a second. So the issue here is that the appliances and the inclusionary housing are stainless steel. However, there's been a new sort of this design issue in a lot of buildings where they want to even hide that the appliances exist, Pete, right? So the refrigerators are not a stainless steel refrigerator. It looks like it's a part of the cabinet and just disappears. So, but I think the issue that reason I bring it up is because these are very high quality stainless steel appliances. It's not as if it's
correct.
The inclusionary are getting a white GE range and everyone else is getting a Bosch. It's all Bosch, just that some are
all the same.
Even fancier than fancy. Is that the way to put it, Penny?
Yeah. Some would say more durable too. Yeah.
Yeah.
So yeah.
Let's go to Betty. Questions? Betty, any questions? McIntosh?
Oh, I asked my question before.
Okay. Martin, you have another question? You're on mute, Martin. You're on mute.
Can I come over? Is the public invited to any of the amenities?
Are any of the amenities ADA?
No, he's asking if the amenities are open to the public.
They are not open to the public. They will be for residents.
They're for the building, Martin.
Yeah.
Is any part of it for the public?
I think not. I think all the amenities are building specific.
Yeah.
Paul Ames, you're the last go here. Any questions? You are mute. You are muted, Paul, as always.
I shall unmute to say I'm fine. Thanks very much. No questions.
All right. And then Maria, any further questions? Done? Great. We're at 9:48. I would entertain a motion to approve this with our normal. Oh, Dolores, go ahead.
No, I'm going to make the motion.
Yeah, please.
Because again, I think that we need to acknowledge that the developer has responded to our requests and our concerns on design and has been able to achieve that. Obviously, after receiving all of the details of the breakdown of the units, as we normally would get, we'll opine on that. And I think that also just saying, again, how the plans are to provide a discount for the amenities, the usual checklist, but most important that we are supportive of the plan as presented to us.
Is there a second?
I second that.
JD?
I would just add that it's been a very productive working relationship, and we're very grateful for that to the developer.
Great.
Us as
All
well.
those in favor of that motion, please raise your hand. All
Aye.
those opposed, I heard an aye from Jessica, aye from Josephine.
Yes, aye.
Okay.
Sorry.
Okay, the motion carries. I want to thank.
Opposed.
You're opposed?
Yeah.
Okay, one against. Sorry. I want to thank the team, Penny, Sarah, and Ken Lowenstein. And I really think this is the longest housing committee we've had in about 8 months.
Oh.
And you were definitely got the winners as the last item on the agenda.
Yes, indeed.
Thank you so much.
Thank you all for your time.
Do we
Good
have a
night.
motion to adjourn, folks? So moved by JD. Okay, thank you all very much. Good evening.